Brittany, this is April. Can you hear me? Hello, Brittany.
April, we're on a break right now.
Oh,
April,
good. Well, I've been
we're
trying.
on a break
I'm sorry,
right now.
Yeah, I know, but nobody can hear me. I've been trying ever since you called my name. I don't know what's going on, but hi.
Okay, we can hear you.
Okay, great.
Finally. Okay.
Okay.
Can I go next?
Yes, I will have you up next.
Okay,
I'm going to put everybody on mute. Please remain on mute until it's your turn to speak. And we'll go ahead and. Oh, no, you're fine, April. So I'm going to go ahead and reconvene this hearing after our break. I just want to remind everyone that the purpose of today's hearing is to take testimony on proposed adoption of OAR 333-019-1025, which is regarding masks being required to be worn in indoor spaces in Oregon. We request that you please limit your testimony to that topic only. And in order to get through everyone who has signed up to provide comments, please keep your comments as brief as possible, and try not to repeat things that have already been said if possible. We are accepting written comments as well.
We all need to know whether or not there are any board members from OHA present in the meeting.
Yes, we do.
We are not considered a board at the Oregon Health Authority, but I do have agency staff on the line with me. We are also recording the hearing and transcribing the hearing and taking notes on what is being said at this hearing, so that all of the testimony and the written comments can be reviewed.
That's a non-issue. We're giving testimony. Let's let it go and move on, please.
And can we have copies or get access to the recording?
Yes, you will need to send a request to OHA Public Records. The email address for that is ohA.publicrecords@dhsoha.state.or.us. Or if you've been communicating with me through the public health inbox, you can just send me an email and I'll make sure to provide you with the information you need for that. All right.
What's your email address?
publichealth.rules@dhsoha.state.or.us. All right, we need to continue on here. The next person we have up is April Groom. If you could please unmute yourself and state your name and provide your testimony.
She's having difficulty. She's trying to hit *6.
Can you hear me? Can you hear me? Can you
Yes.
hear me?
Yes, April, I can hear you.
Hi.
Hi, April, go ahead, please.
Okay, wait, one more time. Can everyone hear me?
Yes, we can hear you.
Oh, great. Okay, thank you. All right. Okay, here we go. Good afternoon. My name is April Grooms, and I live in Bend, Oregon. I am very disturbed by what the state of Oregon is proposing to do with regards to making masks permanent. I am vehemently against the proposed OAR 333-019-1025. I want to remind Oregon Health Authority and all the people on this call that, first of all, we were born with mouths and noses for breathing. We weren't born with masks. This is wrong. Breathing freely is how we get our oxygen. Breath is life. Life. You're talking about making masks permanent, but for what? Permanent for a virus that has a survival rate of 99.97% across the board for all ages. When I look in the dictionary, what the definition of permanent is, it means this: lasting or remaining without change. Not expected to change status, not expected to change in status, condition, or place. We've been masking for 2 years and this is not working. I fear that the permanence of this rule will never be retracted, and that instead we will have permanence of fear, permanent anxiety, permanent mental health issues with our children, permanent attempts of suicide, permanent depression, permanent drug and alcohol addiction, permanent disconnection, permanent interpersonal relationship disasters, permanent discrimination. You know, you talked about equity. This rule is purely not just unconstitutional, but it is discrimination. A permanent lack of oxygen to the brain, which causes permanent brain damage. Oregon Health Authority, this rule is permanently insane. Are you proposing that we permanently will be going into stores where we permanently don't have faces? We were born with faces, including lips and noses. It really disturbs me to see people without lips and noses. It disturbs our children. It's disturbing to society. We were born to smile and to express, and we were born with strong God-given immune systems. We were born to breathe. We were born with ears to hear and lips to speak. And I, for one, cannot hear people when I go to a store. And because I can't see their faces, I can't see their lips and fully understand them. Nor can I speak with a mask on, nor can I breathe. Masks create extreme anxiety. Masks are dangerous. Oregonians do not want to continue this way. We will need to learn to breathe. I want to remind OHA that health comes from healthy living. This is draconian, and this is not right. Please do not pass this rule. Thank you.
Thank you. Next up, we have Kimberly Eng, and then we'll have Rob Maynard and Joanna Z.
I thought Kimberly was on there. Is that later?
I think I just called Kimberly Eng.
Yep, that's me. Are you ready for me?
Okay. Yes, please go ahead.
Perfect. I guess first and foremost, I'm Kimberly. I reside in Portland, Oregon. I am disappointed that OHA faces and names are not on this call. We're introducing ourselves, sharing our names, and they're not here sharing their names. As OHA hides from the people and takes money from the federal government, it continues to perpetuate our questions around corruption. So we the people on this call and we the people across Oregon, we've ended the mask mandate, so we invite OHA to join us. We invite you to formally end the mask mandate and prove us wrong, okay? Just prove us wrong that you're not corrupt or hiding from the people. Oregon should follow the science along with 40 other states across the US, Sweden, the UK, and other places around the globe who've dropped government mask mandates. We should rescind the mask mandate for several reasons, including the following 3 reasons. 1, it's anti-science. 2, it disrupts the learning process. And 3, increases vaccine hesitancy. Universal masking is anti-science. It is not March 2020. We know who is impacted by this virus. 84% of people who've died are over age 60. 92% had pre-existing conditions. 57% of Oregonians hospitalized are over age 60 and 81% had pre-existing conditions. Therefore, people over age 60 with pre-existing conditions are the highest risk for poor outcomes. Rochelle Walensky tweeted on January 9th, we must protect people with comorbidities from severe COVID-19, meaning focused protection. We should follow this guidance, follow the data, and empower Oregonians to make the best choices for themselves based on age and risk factor. Oregonians are not universally at risk, thus we should not be making universal mandated health measures. The science simply doesn't support this. 2, masks discourage the learning and development process in children. Based on the aforementioned data, we know children are at 0% risk of dying of COVID. Since March 20, 5 children have died in the state of Oregon. Oregon children are statistically at a higher risk of poor outcomes with flu and accidents. The risk of COVID is minuscule, while the long-term effects of masking are enormous. Masking is a psychological stressor for our children. It disrupts learning. Covering the lower half of the face of both teacher and pupil greatly reduces the ability to communicate. Children lose experience mimicking expressions, essential nonverbal communication. Positive emotions such as laughing and smiling are less recognizable, and the bonding is compromised. Overall, it's likely that mask exacerbates the chance a child will experience anxiety and depression, which has already surpassed pre-pandemic levels. It's particularly concerning and disruptive for children with ADHD, deafness, or other disabilities. Teachers are fully vaccinated. It is simply unethical immoral, and unconscionable to burden the low-risk children to protect the adults. Are we this selfish in the state of Oregon? Are we this selfish? We must unmask the children immediately. My last point, this discourages vaccine acceptance. 66% of Oregonians are fully vaccinated with 2 doses. Oregonians accepted this vaccine with the hope this would save lives, reduce hospitalizations, and end the pandemic. They hoped we could return to life as normal and remove our masks. However, the opposite has happened. Why the hell would I get a booster shot if I have to wear a mask forever? We invite you to end the mask mandate. Oregonians on this call have ended the mask mandate. Join us and formally end this mask mandate. Thank you for your time and consideration.
Thank you. Next up, we have Rob Maynard, and then we'll have Joanna Z and Melanie Carlo. Do we have Rob Maynard on the line? If so, please unmute yourself and provide your testimony. Joanna Z.
Do you mean Joanna Norovsky?
The name that was provided to me is Joanna Z. Z-E-E.
Oh, no, that's somebody different.
Okay.
Hello?
Hi, Joanna?
Hi. Yes, this is Joanna Z. Can you hear me?
Yes, we can hear you.
Oh, wonderful. Thank you. So I speak for myself and on behalf of Southline Advocates. I am a resident of Cottage Grove, Oregon, and I have certainly appreciated all of the amazing comments and hearing from everyone today. You might not be able to tell because all you're hearing is a digital image of me, my voice, but I just want to assure you that I am a living, breathing, sentient human being. And because of that, I have inherent rights. The right to breathe freely, the right to speak freely, and the right to move about freely. And beyond that, these rights are protected by our Oregon Constitution, the U.S. Constitution, and the Universal Declaration of Human Rights. We are sovereign beings. We are our own inner authority. My personal experience is such that when I put a mask on or cover my face, both my physical and my emotional well-being is compromised. My breathing is restricted, my speech is restricted, and my cognition is affected. Now, I'm a former medical professional and a long-term activist. I have lived a life of service to others. So if I thought that wearing a mask would actually help someone and it didn't compromise my health, I would totally do it, but it doesn't, and it does compromise my health. So you claim that this proposal is about being in service to Black and Brown people, to create so-called equity. This sentiment is actually quite insulting to a certain population and only serves by its divisive nature to keep us from addressing the root cause of the lack of access to healthcare, which pertains more to one's socioeconomic status than the melanin in one's skin. But the links that you actually reference in support of your proposal either don't work, they contain studies that have been superseded by more recent work, or they refer to science that has been bought and paid for by corporate interests. They're not mine. So therefore, we do not trust you, the Oregon Health Authority. We do not trust the CDC, and we do not trust the World Health Organization. You are not our authority. So because you've lied to the people of Oregon, you've proven yourselves to be part of a corrupt globalist system and have violated the Nuremberg Code, and you're supposed to be working for the people of Oregon, not controlling them, we request your resignations. You have no claim or jurisdiction over our bodies. Therefore, regardless of the outcome of any decision that you make regarding this draconian proposal, and even if you try to punish us with your fines, we will not comply. Thank you.
Thank you. Next up, we have Melanie Carlo, and then we'll have Eric Zimmerer and Faith Wolf. Do we have Melanie Carlo on the line? Eric Zimmerer. We have Eric Zimmerer on the line. Can you please unmute yourself to provide your testimony? Do we have Faith Wolf on the line? Yes, Faith Wolf.
Can you hear me?
I can hear you.
Yes, I'm here.
People are having trouble getting back onto your meeting. I have like 6 or 7 messages from people saying they cannot get back in after the break.
Okay, I didn't realize that people were disconnecting for the break. I don't know if that has something to do with us going over the scheduled meeting, since it was scheduled from 10 to 1.
But since it's public comments, it needs to be reopened, because I have at least 7 or 8 friends and probably everybody that you're calling that's trying to get on and can't.
Okay, we'll look into this.
And some people are even saying the number has a message that says if you're trying to get into a meeting, this isn't the right number.
Okay, we're going to look into that.
Could it be that everybody's opposed and that the Oregon Health Authority doesn't want to hear that?
I would just like to respond. My name is Kara Biddlecombe. I'm with the Oregon Health Authority, and for the purposes of this meeting, we will go ahead and adjust any background that is needed to allow people to have access if for some reason going over time is the issue. But I will also say we're closely monitoring anyone who's trying to get into the meeting to quickly allow them in, and I'm not seeing anyone who's in the waiting room. Thank you.
Okay, but the number stayed the same.
Hello?
That is correct. I do want to make sure that we can continue with the public comments, so we will continue to work on this. And Brittany, if you don't mind calling the next person.
This is Faith Wolf. I'm waiting.
Faith Wolf, thank you. Please go ahead.
All right, thank you for taking my comments. As we enjoy day 667 of 15 days to flatten the curve, I'm urging you to decisively strike down this absurd idea of a permanent mask rule. Resist this attempt to penalize Oregon residents who don't want to muzzle their faces. Refuse to threaten them with a fine that is 5 times what they'd be charged if caught in possession of meth or heroin. Fight against this push to continue harming our children. Children are being permanently damaged because they cannot interact with others. Their growth is being stunted emotionally, physically, socially, and developmentally. They need to see facial expressions. They need physical contact with others. They need to play with their friends. They have a fundamental need to participate in the fully immersive human experience with all its potential dirt and boo-boos and germs in order to thrive and grow stronger. You're the health experts. You know this. Instead, in the 22 months since 2 weeks to slow the spread, we have witnessed the organizations that were supposed to be the guardians of truth, science, and public health caught again and again in lies and deception. We've seen all the alphabet groups, the CDC, the World Health Organization, and by following their lead, the Oregon Health Association, all parroting false narratives and hiding or ignoring evidence that goes against what they wanted the people to know about masking, about natural immunity, about the protection that the vaccinations offer. They've all been wrong. Instead of just admitting that the initial ideas were wrong and corrected, which is perfectly understandable when dealing with a novel situation, the public has been gaslit. And gaslit by denying that what they said was what they said, through purposely changing the definitions of words, and even with grudgingly admitted that they lied, but that their lies were noble and for the greater good. And those who have questions have been ridiculed, censored, and called names. We're nearing nearly 2 full years of this, and Oregon still has the most restrictive mask policies in the entire state or nation, and it needs to end. Masks are ineffective at preventing viral spread. The very packaging says so. All of our research says so. All of the charts showing where and when mask mandates were put in across the globe have no impact on the spread of the virus.
Even the notion of asymptomatic spread, which was the basis for mask mandates, has been proven false, and was a study that was based on a model and not a single human subject was used. The facade is crumbling and the truth is being revealed. Turner has destroyed credibility in the institutions that are supposed to keep us safe. It is long past time to end these draconian measures, just like other countries around the world are doing now. Admit they haven't worked and let us live our lives, go to work, run our businesses, enjoy our communities. It's time to stop copying the failures of California that stand for freedom, liberty, of Oregonians, and stop the mass theater, let our children breathe fresh air, allow them to grow and play and learn freely. You at Oregon Health Authority have the power to do this, and you have the duty to do this for the citizens of Oregon. Strike down this rule today. It's the right thing to do. Thank you.
Thank you. Next up, we have Katen McCune, and then we'll have Nan Van Sant and Brendan Young. Do we have Katen McCune on the line? Do we have Nan Van Sant?
Yeah, I'm right here.
Great, please go ahead.
Okay, hi, this is Nan Van Sant from Brownsville. Can't believe I've been on here for 5 hours. But I'm really honored to follow those who've spoken before me because they really do give me hope. And I only hope that the OHA will actually listen to some of this in our words rather than in just writing. I'm one of those who's become really jaded about our democracy over the last few years. One of those people that used to be a Democrat. I don't know what I am anymore. But I think the loss of trust in our government is perhaps the biggest casualty of the pandemic response, and it has long-term consequences. I'm also a nurse. I've been a registered nurse with my bachelor's for 43 years in the hospital. The last 20 have been in oncology. I'm very familiar with masks and when and where we should use them. And I do not believe the general public should be wearing them right now. In the medical facilities, it's a totally different issue. And if somebody feels better to wear them, they should wear them. If you're autoimmune disease, etc., go ahead, wear them. That's good. But don't make it good for everybody. I'm really angry for a number of reasons for OHA. One of the things is they're using hospital capacity as an excuse. Where were you during our other flu seasons? Are you aware that in almost every flu season, we've had ED patients in the hallways for hours and sometimes even days? I recall one man that came up with bed sores because of the wait. Where were you? It's not been unusual for a hospital to divert patients to other hospitals or postpone surgeries during a bad flu season. That's not unusual. It's probably happening more now, but where were you then? Why did you ignore this issue before the pandemic, and yet now you're using it as a convenient excuse? Staffing has always been an issue, and now it's worse than ever. Nurses and patients and all the medical people are suffering, not just because of COVID, but because of negligence on the part of our health authorities. Another thing I'd like to point out is I was born and raised in Japan. Japan often gets pointed out as a success story because of masking, but that is confounding data. The Japanese overall health is in many ways superior to ours. For one thing, they have virtually no obesity. I mean, they're not even like 30 pounds overweight. And here, 2 years later, that remains one of our biggest risks for severe COVID, and yet it's hardly ever discussed. Masks, the other thing for our immune systems, we benefit from being exposed to low levels of bacteria and viruses, and masking is depriving that of that. Masking also makes us want to breathe through our nose, and again, that breaks off that, it bypasses our nose, and that's not healthy because that's our first line of immune defense. So anyway, mandating masks for the current state of this virus is just plain illogical, and it often reminds me of the story of the emperor's new clothes and the child that pointed it out. There's no science, logic, or compassion for this mandate, and I was just thinking on the last call that perhaps one of the reasons that they're pushing this mandate so hard, despite the fact that there's no science or logic behind it, is they could be using it as a tool to try and get more people vaccinated. One of the vaccinologists in Israel just admitted that that's one of the reasons they're using passports over there, you know, that they want to push the vaccines, even though they don't necessarily work that great. So I'm wondering if that's part of OHA's plan here. But anyway, so finishing up, the logical decision would for OHA to be finally honest. Tyranny is the deliberate removal of nuance. I ask you to reject tyranny and acknowledge the many nuances inherent in science, common sense, and treating the whole person. I stand for honesty and choice, and I will not hide my smile.
Thank you. Next up, we have Brendan Young, and then we'll have Amanda Fisk and Kelly Barnett.
Hi, yes, I am Brendan Young. I have a counseling practice in the South Willamette Valley, and I'm just calling to express my concern. I don't really affiliate with a party, a political party or anything like that, but just over the course of this time, and I'm sure that my colleagues who are in the same field have noticed that the clientele that are coming in to see us are suffering from a lot of fear, and it's fear surrounding nebulous, unknown things, bad information that's been given during the course of this pandemic in this state, but all around the country, has contributed to a significant increase in my personal experience in the levels of fear and anxiety. And as many have said before, the ability to read expressions, to see faces, is of critical importance for humanity. And I work mainly with adults, and I can speak to that only, really, is that even adults need to have the ability to see and experience the whole spectrum of human expression. I would just like to say that my practice, I don't require people to wear masks because of the significance of the mental health crisis. I will continue not to require, no matter what rules are made here. And while I respect you guys and I appreciate all the good things that you've done, I cannot comply. I will not comply. For the good of my clientele, for the good of my family, and for myself, and for all of my fellow Oregonians. And just last thing, I just want to say, Brittany, you're doing a great job, and thank you very much, all of you. I yield back my time.
Thank you. Next up, we have Amanda Fisk, and then we'll have Kelly Barnett and Keith Rafinot.
Brittany, this is Jim Schaefer. Do you have my name on your list?
Hi, can you hear me? Hello?
Yes, I can hear you.
Okay.
Jim, I'm checking. Did you contact me ahead of time and receive an email back from me?
Yeah, days ago, and I'm surprised I wasn't sooner on the list because I figured it went to my entry level persons.
Okay. I'll keep looking through the list as we have our next speaker up. Is this
Okay,
Amanda?
thank you.
Yes, this is Amanda. So,
okay, please go ahead.
I'm here today to let you, OHA, and the callers that are present about some cases that am jurisprudence with Book 16 Constitution Law section. So the first court case I'd like to discuss is 16 Amjur 2D section 97. That says that you, me, everyone on this call is the beneficiary of the Constitution. We are the people who receive the Constitution. The second one, 16 Amjur 2D section 98, says no emergency has just cause to suppress the Constitution. We will not comply. None of us will comply. We are done with this
complying.
communist takeover.
Communist.
Amanda, we're going to have to ask you to unmute yourself again. We had to mute everyone.
I'd like to say thank you for giving us the opportunity to speak, even though we probably will not be heard. The founding fathers and founding mothers held protests where they hung members of the government, likenesses of the members of the government, and I'm pretty sure we're not that far away from that this time. So thank you for your consideration.
Thank you. Up next, we have Kelly Barnett, and then we'll have Keith Rafinot and Robert Eagle.
Hi, can you hear me?
Yes.
Yes, hi. I would like to introduce myself, give a little bit of background, if I may, before I make my statement. So I'm Kelly Barnett. I would like the listeners and Oregon Health Authority to know that I was working in public health post 9/11 when Congress authorized the Communicable Disease and Bioterrorism Preparedness Act, which included pandemic preparation and preparedness. I was also acutely aware in 2011 that the federal government gutted the programs and plans that we had worked on in this state for a decade and changed the federal law, which allows the Centers for Disease Control to step in on a state under 42 CFR Part 70 and 71 at their discretion to take control of an emergency response. Also, under the U.S. Constitution, Article 1, Section 10, Clause 3, states can't enter into a compact without the blessing and the direction of the federal government, which leaves me feeling sorry for both our Oregon Health Authority and the citizens of this state, because I'm not quite certain that our state is operating under our own public health laws and under our own discretion at this point. That being said, I'd like to address the indoor masking requirements. I do believe in the proper use of personal protective equipment, but there is a difference when you're working in public health between teaching respiratory hygiene and teaching respiratory protection. And as a matter of safety, and as clearly stated in the Oregon Bench Book for isolation and quarantine measures, public health rules and public health court orders cannot be attained as a matter of safety, because safety is a purely legislative process. I do think that the permanent use of a masking requirement through administrative rule is improper, but I do believe that there is a role for Oregon Health Authority as we continue to move through this pandemic, and one of which is to teach the difference between respiratory hygiene, teach our people how to properly doff, and when they should be changing masks out, if they're reusing masks, how they should properly launder them, and let it be a choice. And the reason is that our history as public health demonstrates that when we make our citizens part of the solution rather than the problem, that we're more likely to get an uptick in the behaviors that we would like to see. And I think that we could easily go through and use some of the federal dollars that we have to educate the public on the difference, and also to educate the public to stop using discriminatory behaviors against those who can't or don't want to wear a mask. There is a difference. We're a little beyond the mandates, and we've not used our courts properly during this procedure. And I will close with saying that I have read every single grant and every single document and supplemental funding requirement, and the state and the citizens have a right to both argue for their 10th Amendment rights, and the CDC cannot put restraints on your activities through a contractual language that actually contradicts the 10th Amendment. So you do have a right to tell the federal government that you will be policing the state as you see fit, and you can listen to the people who can also separately enforce their 10th Amendment rights if it has to go that route. And thank you.
Thank you. Next up, we'll have Keith Rafinot and then Robert Eagle. And then we will have Rob Maynard if he's been able to join back. So do we have Keith Rafinot on the line?
Yes, this is Keith Rafinot. Can you hear me?
Yes.
Perfect. All right. Wow, it's been a long day. I've probably changed my presentation or my talk 4 times because I don't want to be repetitive. So here we go. I do want to start by thanking everyone on the call and to also mention that there are 2 more calls coming down in the next couple weeks, and I strongly suggest you get a head start, get out there and tell everybody else about these 2 calls so we can have well over 200 to 250 people willing to speak and drag this out for an entire day. I am here today to vehemently disagree with any permanent rules regarding masking in public spaces and request that all mask mandates be dropped immediately. Not to be repetitive, but masking is dehumanizing, creates long-standing emotional and physical side effects for years to come, especially in our children. I have seen the effects of masking with my 2 young boys, and it is very disheartening. Masks create a constant reminder that the population is under threat, even though the threat of death is really minuscule. This is wholesale abuse on our population and children, and a contributing factor to the reason why Oregon is number 7 out of 50 states with the highest rate of depression. And this is from Becker's Hospital Review just recently. The most common fallback I hear in support of masking is that it protects our hospitals from being overcrowded. A gal earlier had mentioned that on a regular flu season, hospitals are overcrowded, upwards of 90 to 95%. And that is a direct relation to the fact that the state of Oregon and Washington are number 50 in the state in hospital beds per 100,000 people. So why are the citizens of Oregon being held accountable for our healthcare systems not adding hospital bed capacity commensurate with the growth in Oregon's population? We just recently added, from the new census, we've had massive growth over the last 10 years, and our hospitals have been stagnant. So again, I ask, why are we being held accountable? Because our hospitals have not kept up with the population growth. In the sense of equity, and which was in this statement that the masking is for those who, equity. So in closing, I'm also here to tell you that enough is enough. Months ago, my wife and I chose to put COVID in the rearview mirror. I will respectfully not comply with masking mandates and spend my money at businesses that do not enforce them. My next step will be to pull my kids from public schools, and we'll be finding alternative options for them because it is clear that our government is not looking out for the best interests of its most valuable resource. Many out there will disapprove of my actions and positions on these mandates, and that's all right, because I follow the belief that the disapproval of cowards is praise for the brave. That is it. Thank you.
Thank you. Next up, we have Robert Eagle, and then we will have Rob Maynard and Eric Zimmerer. So Robert, if you're on the line, if you could please unmute yourself and provide your testimony. All right, I'm going to go back up to Rob Maynard. Do we have Rob Maynard on the line? And I do want to let you know that there was some concern that people weren't able to join back in the meeting, but we have heard that participants have been able to join back in, so it shouldn't be an issue using the login information that was provided. Is there a Rob Maynard? Has Eric Zimmerer been able to join again? Caton McCune? Okay, next up we have Lowton Hooley, and then we'll have Anna Collins and Glenda Sherrer. Do we have Lowton Hooley on the line? If so, if you could please unmute yourself to provide your testimony.
Hey, Brittany, can you hear me?
Yes.
This is Shawn Hartfield with the Redmond School Board, and I'm just wanting to make sure that I am on the list somewhere because I've been on since 10 this morning.
Yes, we do have you on the list, and we are still working through people who had contacted me ahead of this meeting to provide testimony.
Okay.
I mean, she's on the school board, Redmond.
Do we have Anna Collins on the line? Glenda Sherrer?
Yes, I'm here.
Great, please go ahead.
Okay, thank you. Well, I have a couple of things to say. First off, I originally had written my speech to say good morning, but it's now good afternoon. And I'm so proud of all the Oregonians who have stuck in for nearly 6 hours of testimony. I'm very proud to stand with you. I would like to thank you for giving me this opportunity to join in today and share my testimony. My name is Glenda Sherrer, and I'm the founder of Unheard Parents. I'd like to talk about something that hasn't really been covered very much. I think maybe 3 or 4 people talked about it, but I really think that it's important to bring it to the forefront. We need to assess where we are right now and what facts and what stipulations are happening. We currently do not have credentialed or trained leadership heading up the Oregon Health Authority. It is amazing to me that we are 2 years into this. I believe it's 53 days until the 2-year mark. And I believe that we should not consider any further mandates, permanent or temporary, until we have qualified leadership heading up our health department. Patrick, we have to be very clear about this. Patrick Allen is not qualified for the job he holds. He does not have a science degree. He is not a doctor. He's not a nurse. He's not even a certified nurse's assistant. He may be trained in first aid, but I don't even know if that's true. He does have a business degree, and he may be a nice person, but his lack of qualifications demands that we not move forward with any decisions that are so egregious and overreaching and intimidating to the people of Oregon. Additionally, Dean Seidlinger, who is labeled as our state epidemiologist, is not in fact an epidemiologist. He's a pediatrician. Until Patrick Allen and Dean Seidlinger are replaced with qualified, credentialed leadership, and the Oregon Health Authority rebuilds the trust and confidence in Oregonians, we must pause and not consider any further action. In the fall, as an example, in the fall, I believe it was in October, fall 2020, there was a person who was dressed up as a clown who announced the death rates in Oregon. Overall, Oregon Health Authority has lacked common sense. Oregonians do not have any trust in it, and it needs to be fixed. One other thing that I'd like to add is that another example of common sense is that people should not have to put in a FOIA request to get a copy of this audio file. It should be placed on the OHA website. If you're truly committed to common sense and to the betterment of Oregon, you need to be much more transparent and not require people to put that in as a FOIA request. I mean, oh my God, what a waste of taxpayer money. Thank you so much.
Thank you. Next up, we have Becky Dubrasich, and then we'll have Meredith Payton and Karen Calcagno. Do we have Becky Dubrasich on the line?
Yeah, I'm here.
Great. Please go ahead. State your name and provide your testimony.
I had my earbuds in. Let me see if it's going to work. Okay. So you can still hear me?
Yes, we can hear you.
Okay. So hey, my name is Becky Dubrasich. I'm an experienced ER nurse in a medium-sized urban hospital in Oregon. I'm also a mother of 3 boys who are required to wear masks at school. Oh yeah, I'm definitely against the indoor mask mandate. I have believed that cloth masks are ineffective at preventing the spread of viruses since the pandemic started. The CDC is now speaking about concerns about the masks as well. Last I heard was that surgical masks were better and N95 or KN95 are being recommended. COVID goes through cloth masks easily. Surgical masks are similar. The impression so recently that N95s are preventing COVID spreading.
Becky, we're having a little bit of trouble hearing you. I need to go ahead and mute everyone, and then I'll ask you to unmute yourself, Becky. Okay, Becky, if you could unmute yourself and continue, please.
I wear an N95 at work around my respiratory patients, and about okay, and was concerned it was related to the mask mandate in schools. Mouths are breeding grounds for bacteria. I am concerned that keeping the mouth covered for hours of school, which interferes with the body's immune system's ability to keep mouth bacteria within a safe level, is detrimental to our children. I also read recently the brain infections are up by 60-fold, and I'm concerned that this is due to overgrowth of bacteria in the mouth from our masks. My 2 older boys have told me that they like masks so they don't have to show half their face. My teenager recent told me that people look better in masks. My concern is that we are normalizing covering faces and it will have a long-term harmful effects for our children. Charging a $500 fine for not wearing a mask indoors is ridiculous in my opinion. Do our police officers really have the manpower to enforce such a law? There are many businesses that no longer care if people wear masks. It's a punitive, ineffective, and unfair proposal in my opinion. It's time to let Oregon citizens do what feels right for themselves and their families. We have all the information to make decisions for ourselves now. Wear a mask if you feel like it protects you from COVID. I personally feel like my healthy, strong immune system prevents me from getting COVID. Since the pandemic started, the media and the people in power have emphasized fear, death, masks, and vaccines. Today, I want you to think long and hard about what if we decided to put all the manpower, time, energy, and taxpayer money into focusing on wellness instead of permanent mandates. We could send out information to the public about healthy diet, exercise, stress reduction, and immune boosting nutraceuticals instead of more of the same that isn't working to change anything about the pandemic. Thank you.
Thank you. All right, next up is Meredith Payton, and then we'll have Karen Calcagno and Christina Carmichael. And again, please, if you're not speaking, remain muted. We're having a hard time hearing the speakers when people unmute themselves.
All right, hello, this is Dr. Meredith Payton. Can everyone hear me?
Yes, we can hear you.
All right, so for the record, my name is Dr. Meredith Payton. I'm a licensed physician in the state of Oregon. I am not here with any affiliated organization. However, I would like to mention that a number of my colleagues are absolutely terrified to speak out about this. So if I'm taking it for the team today, I hope everyone else has my back in the future. I had, like everyone else has said before me, a really radical speech planned out. I ended up crossing off a lot of redundant things throughout the day. So I would like to just focus on the bulk of my testimony, which is the effect of masking on the pediatric population, which a lot of people have talked about. But here are some quotes and research that I have done. and from clinical observations of myself. Masks are known to be troublesome for myopic children, which means they are short-sighted due to glasses fogging, which is a highly documented problem for medical students in operating suites. If any of you wear glasses, you go to the store, how do you notice anything? You see anything? My mom wears glasses, she can't see anything. How do you think a little kid in school feels? They are already completely stressed out. How about maskne? Has anyone seen maskne? Have you had maskne? It causes dermatitis, acne, painful sores, histamine reactions that only resolve with discontinuation of the mask wearing. Sometimes treatment must be initiated. Painful, irritated lips are also common. My daughter is a first grader and she comes home daily with excoriated lips and nostrils from excessive moisture trapped in her mask and from mucus from her nose. She is to wear a mask during PE and indoor recess. She can only take it off to eat and drink water. She never sees her classmate or her teacher smile every single day. I'm going to skip the portion about carbon dioxide and deoxygenation. Everyone has pretty much nailed that. Masking traps condensation, which promotes viral, bacterial, and fungal particles to be condensed within the mask, creating a reservoir for pathogens, promoting disease states, including COVID-19. We have seen an uptick in oral infections, gum disease, tooth decay, pharyngeal infections, sinus infections, alarmingly now, deep lung and intracranial infections, which the RN before me just stated. This also brings me to another topic, a mask survey that was recently out with people. They have been shown to cause anxiety, psychovegetative states in children, as well as adults, with an increase in psychosomatic and stress-related illness, depressive self-experience, reduced participation, social withdrawal, lowered health-related self-care. Children who are suffering learning disorders, there is a 364% increase in delays with speech. They are not calling it COVID delayed. It's on par with how autistic children are functioning. We must stop masking children. We must stop masking basically everyone. As a physician, I'm completely appalled that this is even an issue. And I sincerely hope that I do not have to come back and testify for vaccines in the near future. Thank you very much.
Thank you. Next up, we have Karen Calcagno, and then we'll have Christina Carmichael and Lisa Davis.
Hi, this is Karen Calcagno. Can you hear me?
Yes, thank you.
Great, thank you. I am from Beaverton, Oregon. On January 10th, I'm not going to go over what everybody has said, who have just done a fantastic job today. But I'm sure you guys already know all this stuff. So it's really suspicious to me that we're even having this. But on January 10th, which was just 10 days ago, the CDC stated that 75% of the COVID deaths occurred in people with at least 4 chronic diseases. And then they said that the vast majority of cases are mild and doesn't cause significant illness. And though you know, and I know, as we've already covered here today, that wearing a mask all day certainly does. I have lived here, born and raised, for 62 years. And I have to say, it is really disturbing to me that I even have to be here today to remind this agency, this government, that what you are proposing is unconstitutional. I do not consent to a permanent indoor mask rule, quote. Thank you so much for being here. I appreciate your whole day. Bye.
Thank you. Next up, we have Christina Carmichael, and then we'll have Lisa Davis and Mark Thielman.
Hello, I'm Christina Carmichael. I'm an intensive care nurse from Lane County. I'm also a union president for one of the largest nursing unions here in Oregon. I'm here speaking on behalf of myself and fellow Oregonians. A little bit of history back in March 2019, when COVID first broke out. I was wearing an N95 mask. I got called in the office and reamed because I was scaring people. I knew the micron size of this virus because I'd done my research, and I don't speak out or say things unless I know them to be true and factual. And what I can tell you that is true and factual are that the COVID numbers in Oregon are plummeting. Our rates of transmission are reduced. Omicron has hardly anybody in the hospital, and we hardly have any deaths. Sweden, Norway, Brazil, England, Virginia, Florida, Texas, Arizona, Montana have all worked to end mask and vaccine mandates. And yet here we are today with OHA proposing a permanent rule. And we ask ourselves why. Most people have covered this already. They've established that masks don't reduce the rate of COVID. Masks have never reduced the rate of COVID transmission. You look at every time we've implemented mask mandates in any state or any country, never once has the transmission rate been reduced because of those mandates. Instead, we have an increase of 53% female youth suicides. We have depression and violence and poverty. We have joblessness. We have homelessness. Oregon is a flipping wreck. Governor Kate Brown knows that she has ran out of time. Her mandates are out of time. And now she's asked Oregon Health Authority to step in and permanently mandate these masks with no guidelines and no metrics as to when they'll stop. We've already met those metrics, people. We are done with masks. We are done. They don't work. It is a farce. It is time to take off the masks, and Oregon is rising up. I wanted to share a little bit of information that nobody else has really touched on. The Oregon Health Authority was charged with implementing the safe staffing law. And here's what I'll tell you, as a union president, I've seen multiple reports of unsafe staffing. I've seen people injured because the hospital admits more patients than the nurses can safely or legally care for. I've seen nurses fired, standing on the line saying, no, we cannot take another patient. I will not, this is not safe. I will not risk my license for this. And yet those reports to Oregon Health Authority has not resulted in one single fine to Oregon hospitals that habitually offend and bring in illegally too many patients and not enough staff. So how are you going to enforce a mask mandate with a $500 fine when we know masks don't work? Let me tell you this. Think about Australia. I'll go ahead and wrap up if you want to mute that for a minute. Think about what happened in Australia when they mandated masks and they mandated vaccines and they mandated passports. You had children in the roads being choked out by police because they weren't wearing a mask. That's how it got enforced. You had elderly women thrown to the ground. Learn from Australia's mistakes, okay? And instead embrace what the rest of the globe is doing, like Denmark and UK, and go ahead and embrace COVID and know that these many exposures to Omicron, this very mild cold, is not actually a bad thing. It's going to give us a boost in our immune system, and it's going to prevent vaccine dependency. This is where we're going, and OHA needs to step back. You have no authority. We will not comply.
Thank you. Next up is Lisa Davis, and then we'll have Mark Thielman and Shawn Hartfield. Do we have Lisa Davis on the line? Mark Thielman?
Are we sure that's Mark Thielman and not Mark Gatlin? Because I've been called Thielman before.
It's spelled Thielman.
Not even close.
Okay. I'm going to move on to Shawn Hartfield. Shawn, if you're still on the line, if you could unmute yourself and state your name to provide your testimony.
Hi, my mom's Shawn Hartfield, and she's on her way. So we are kind of like jumping back in between sports. So could you like hold on for a second or skip us for a second?
Sure, I'll move on to the next person and I'll come back to her.
Okay, thank you.
This is Lisa Davis. Can you hear me?
Yes, Lisa Davis.
Shall I go now, or are you waiting for the other person?
No, you can go ahead and go. Thank you.
Okay, thank you. I'm just blown away with the quality of all the speakers that have gone before me. It's been absolutely astounding, and I second everything that everyone else said. What I wanted to say was C.R. McIntyre did the only placebo-controlled double-blind clinical trial on cloth face masks and found that not only do they not work, but wearing the face mask across a 3-year study increased influenza-like illness. That led to the April 2020 publication by the Journal of American Medical Association, which clearly stated that a healthy population should not wear a mask. In every state, including Oregon, it is illegal for anyone to practice medicine without a license. It's also illegal to violate the Federal Trade Commission Act and specifically the deceptive medical practices component of that act. Face masks have never been shown in the standard set by the Federal Trade Commission to have a benefit. In fact, they have been shown to create problems. So any mask mandate, any recommendation or requirement is first and foremost a violation of the Medical Standards Act of every state, and second of all, a violation of the Federal Trade Commissions Act, Deceptive Medical Practices section, and third, against medical advice. You can't even be a licensed medical professional and give evidence or suggest therapy that has been contraindicated to the thing you are promoting. So every single person, health authority or business that has promoted a face mask, intervention, or requirement has violated the Federal Trade Commission Act, which at the very least is a civil charge, but in some cases can rise to felony charges. You have been put on notice. We will not forget who has been promoting these, and you will be held accountable. We will not comply. Thank you.
Thank you. Next up is Shawn Hartfield, if she's available, and then we'll have Elizabeth Leander and Steven Gotokis.
You can skip us again.
Okay, thank you. Do we have Elizabeth Leander on the line?
Yes. Can you hear me?
Yes, I can hear you. The connection is a little bit poor, but please state your name and go ahead.
Okay. Sorry, can you hear me now? Is that better?
Yes, I'm going to go ahead and mute everyone again, and then Elizabeth, I'll have you unmute yourself. We really need everyone to stay muted unless it's your turn to speak so that we're not having these interference issues. Okay, Elizabeth, please go ahead.
Okay, can everyone hear me now?
Yes, that sounds better. Thank you.
Okay. Hi, my name is Elizabeth Leander. I am a registered nurse specializing in emergency medicine, and I'm from Clackamas County. And it should go without saying that I am vehemently against the mask mandates in Oregon. I don't want to reiterate what everyone else has already said on this call. A lot of it has been really informative and great. I just want to reiterate the skyrocketing mental health issues that I've personally been caring for in the emergency room, including people as young as 12 years old. So I just want to say that continuing a mask in the face of Omicron, and I believe when this proposal was created, it was back when Delta was still ravaging back in August. So these mandates are completely outdated and don't reflect what's going on right now with Omicron. And continuing to go on with the mask mandate, it's completely unconstitutional and will do nothing to help Oregon move on past COVID. And I yield back the rest of my time. Thank you for the opportunity to speak today.
Thank you.
Brittany, this is Shawn Hartfield. I'm back.
Okay, great. You can go ahead and start.
All right, my name is Shawn Hartfield. I'm the board chair. Oops, sorry, I just moved my mic. Board Chair for the Redmond School Board, 2J. I am speaking on behalf of the Redmond School Board. We represent over 30,000 Oregonians here in Central Oregon. Redmond School Board, 2J, opposes adoption of the following OAR 333-019-1025, requiring masks to be worn in indoor spaces in Oregon. Each board and committee member. The Board of Directors for the Redmond School District urges each board and committee member in the strongest possible terms to stand firm against and halt the efforts of the OHA in adopting mandates set forth in OAR 333-019-1025 and return control over pandemic-related safety measures to local government bodies, including local school boards. The OHA, according to their website, values transparency, accountability, and the wise use of public resources. In addition, OHA's non-discrimination policy specifically states OHA will make reasonable changes to policies, practices, and procedures by talking with you about your needs. Oregon School Board members, along with the people of Oregon, do not feel heard, nor is the OHA being held accountable to impose the will of local elected officials. On August 25th, 2021, the Redmond School Board passed Resolution 21:163, demanding local control over pandemic-related decisions. In addition, restoring local control was a prominent topic expressed by the Oregon School Board Members Association throughout the state during the 2021 fall listening sessions conducted by the Oregon School Board Association. Following through with the proposed rule changes completely ignores the will expressed by the Redmond School Board and retains decision-making authority at the state level. We implore you to take these things into consideration and make reasonable changes to policies, practices, and procedures and listen to the needs of Redmond School Board by stopping the OHA's proposed rule changes, effectively returning control over pandemic-related decision-making to the local level. In addition, according to OHA's own non-discriminatory policy, OHA must follow state and federal civil rights laws. It cannot treat people unfairly in any of its programs or activities. As a board, we also have grave concerns that adopting these rules changes would effectively create de facto discrimination. To mandate masks as a prerequisite to attend school in Oregon openly discriminates against students and families who exercise their right to decline masks. By OHA definition, a mask is a medical grade mask and maintain control over what goes onto and into their and their children's bodies. In conclusion, the Redmond School Board is very concerned about the potential these proposed rule changes have to exacerbate the challenges currently facing the students, families, staff, and our community as a whole. Thus, the Board of Directors of the Redmond School District urges each board and committee member in the strongest possible terms to stand firm against and halt the efforts of OHA in adopting mandates set forth in OAR 333-019-1025. And this was signed by myself, the board chair, Redmond School Board Director Jill Cummings, Director Carrie Lopez, and Vice Chair Michael Summers. Thank you.
Thank you. Next up, we have Steven Gotokis, and then we'll have Paige Crammond and Shane Peck.
I'm here.
Can you guys hear me? This is Mark Thielman. You guys called me and I had some technical difficulties. I couldn't get unmuted. Is there any chance I could just jump in and go?
Yes, please go ahead.
Okay, my name is Mark Thielman. I'm superintendent of the Alcee School District. It's kind of fun to follow the Redmond School Board. So real quick, this is my OHA testimony on this particular masking rule. First of all, heard a lot of speakers today talk about loss of IQ and the negative effects of masking on kids. My favorite quote was the 23% loss of IQ, which has been cited in many journals. So I think we can assume that it's a legitimate fact, and some of that loss is contributed to by masking. I want the public to know that I personally lost 23% of my IQ reading your proposed rule. So a couple of facts, things that are new that haven't been talked about. There's 4 C's you got to have as a government agency: competence, credibility, confidence of the public, and common sense. So I'd like to go through these 4 things real quick to talk about myself as a school superintendent who is now on Rule Change 9000 from the OHA as a person trying to operate a school and school district under the ever-changing rules. So number one is competence. Governor Brown, Patrick Allen, Dr. Seidlinger has said before, they're not competent. For example, it's a requirement normally that you have competent rules. However, you guys have engaged in a political process, in my opinion, because everyone knows, and all the scientists know on 3 continents, that masking is ineffective, yet incompetent people are pushing it out anyway. Number 2, it harms credibility. Credibility is critical. So for example, we started out with 15 days to flatten the curve, and now 2 years later, we're still working on ever-changing variants and rules. That harms credibility. But I think I was out in the state graveyard where although the pioneers had been buried, and I did see the epitaph of OHA's credibility. It's a nice gravestone, and it says, and I quote, "Here lies OHA's credibility." And my question to you guys, and you can write the answer in the chat, and I'll look it up later, is did it die with COVID or because of COVID? That's my question. I'll leave that. Third, you guys have lost the confidence of the public. As a school administrator, I'm pulling my hair out because every middle school and high school kid gets news briefs on their cell phones or their computers or their devices or their laptops. And, even Dr. Fauci said masks don't work for Omicron. So, and you guys are looking at that. You're a fan of Dr. Fauci, I'm assuming, and he's our country's premier expert, and he says they don't work. So what does our state Oregon Health Authority want to do? They're going to further erode public confidence by trying to impose a rule and make an ineffective rule of masking permanent. And that leads to my 4th thing. By pushing for this rule and even writing it, you have absolutely killed common sense. So let me conclude. Everyone with an IQ knows that masking doesn't work. And you guys are now responding to the obvious by saying, let's make it permanent. That harms my IQ, and we go back to the beginning. Thank you for letting me speak. Again, Mark Thielman, Alcee School Superintendent. Take care.
Thank you. Steven Gotokis, you're up, and then we'll have Paige Crammond and Shane Peck.
Can you hear me?
Yes, thank you.
Thank you, Brittany, and everyone here today for speaking. Hello, my name is Steven Gotokis, Brookings, Free Oregon, January 20th, 2022. Condemnation without investigation is the height of ignorance. Albert Einstein. This is your notice of liability. We, the people of Oregon, know what you're doing. Your agendas 21 and 30, your Great Reset, your Build Back Better Globalist Initiative, ID 2020, and your Event 201, Fall 2019, that predicted all of this, not to mention multiple coronavirus patents from years before. We know what you're up to with your Carrie Mullis's overcycled PCR false positives and the revolving doors between Big Pharma, the CDC, and the FDA. You guys have lost all credibility. As unelected officials without medical degrees attempting to adopt administrative rules to coerce and fine individuals for any sort of face covering or vaccines for that matter, all under emergency use authorization as a medical device and a medical procedure respectively for a disease with an over 99% survival rate. You cannot show us an isolated virus or connect it to disease, nor can you show conclusive proof that masks are effective. You have ignored all dissenting opinions, professional or otherwise, and all other opposing medical research and views. This is a fundamental breach of the basic tenet of law, audi alteram partem, to hear the other side. If you and the governor and other executive officials do not cease and desist, the people will pursue justice to the fullest extent of the law. Dr. David Martin reminds us that the United States embraces the Nuremberg Code under 21 Code of Federal Regulations, section 50.23 and .24, that states it is illegal to coerce anyone to participate in these continued medical experiments of vaccines, masks, and PCR tests under 18 U.S. Codes 2331 and subsection 802. Coercion is defined as domestic terrorism. This is a felony punishable by up to 99 years in prison and up to $100 million in fines for institutions. By continuing, you risk facing charges for crimes against humanity, treason, and sedition, as is currently being pursued by Dr. Rainer Fulmisch of the Coronavirus Investigative Committee and just recently separately filed by the People of Truth in the International Criminal Court at the Hague Tribunal. Thank you for your time.
Thank you. Up next, we have Paige Crammond, and then we'll have Shane Peck and Sarah Cassidy. Do we have Paige Crammond on the line?
That was amazing.
Paige
Thank you
Crammond's
for
here.
putting that on notice.
Get on this machine.
Hello?
Hi, is this Paige? We have Paige on the line. If you could please unmute yourself and state your name and provide your testimony, please. Do we have Paige on the line? If so, please unmute yourself and provide your name and testimony.
Hello? Hello?
Yes, yes, we can hear you.
Okay. Where did you ever hear me? I'm going to start from the top. Good afternoon. My name is Paige Crammond. I really appreciate all of your time. I'm in Eugene, and I'm here to discuss why a permanent mask mandate for Oregon does not make sense. As a state licensed and nationally certified speech-language pathologist and a mom, I'd like to add my concern about children's lack of exposure to faces and expression in speech and language. I agree with others that this rule could take a developmental toll on a generation of Oregonians, worse than the effects of COVID-19 disease. I would also like to thank the several folks with disabilities who have educated us today about how this rule impacts their ability to interact with and access society. Please do not persist in unfairly excluding already vulnerable Oregonians from participating in life in this state. Please note that others have already mentioned related concerns with the suggested fines. You say you seek to reduce the disparate impact of COVID-19 on those communities who have had inequitable outcomes from COVID-19 disease. But what about the Oregonians who have had inequitable outcomes from COVID-19 isolation, poverty, stress, uncertainty, you name it? Can a mask mandate really cure inequality? Please consider that your fellow Oregonians, many of whom have spoken today, are also thoughtful, educated, informed, passionate, and productive members of society, and we respectfully do not agree with your methods. Please respect our experiences and try to understand our views. Ask yourselves, why is Oregon one of only a few states with statewide mask mandates? One might think that if the data were so irrefutable, mandates would be unnecessary and pushback from regular people scarce. Today's testimony show this is not true. Why do you say that droplets are, for the first time in human biology, deadly vectors of disease, even for people who feel healthy, but in the same documentation, you say that the same droplets are not a concern if you're performing in a play or playing a sport, both of which require close interacting with extra singing, talking, and breathing. It would almost seem like masks are simply a visual symbol of control and compliance, and that the exceptions that you allow represent hard, common sense boundaries of human citizens rather than some respectable scientific basis. Please look into your own anxieties and biases and own them as your own. I would argue that resuming natural interaction with whole faces would enhance everyone's overall health. Thank you for hearing my testimony with open minds and hearts. Good day. Thank you.
Two big lights to face, and you need a little, little light.
Thank you. All right, next up we have Shane Peck, and then we'll have Sarah Cassidy and Kate Savannah. Do we have Shane Peck on the line, or Shane Petch? Do we have Sarah Cassidy? Do we have Kate Savannah on the line? And then up next would be Deborah McGuire and Jerry Russell.
Do we have Deborah McGuire?
Deborah McGuire here, just walked back in the door.
Great, thank you. Please go ahead and provide your testimony.
Okay. Good afternoon, and thank you for hearing my testimony. I am against. Who here voted for Tony Fauci? I'm asking because he's the most influential American, setting policy for your life and lack of health. He has financial conflicts of interest and stands to gain wealth with the decision he makes. He claims to own science, so if you disagree with his statements, according to him, you are anti-science. 2 years ago, Fauci said that masks could not control viral spread due to the tiny sized viral particles easily passing through masks. A year later, Fauci said to wear masks. In fact, wear 2 masks. We can all see that mask mandates have been completely useless in stopping the spread of the virus in the past. Currently, although we still have mask mandates in place, we see the virus spreading more virulently than ever. So we know that masks have been ineffective in the past and also presently. Why on earth would we determine then that a permanent mask mandate would be effective? It didn't work. It's not working. So let's make it permanent? How does that make sense? A big concern is the negative impact that masks have on us, both physiologically and psychologically. Life begins with our first breath and ends with our last. In between, we need to breathe and maintain our oxygen levels. Interventions to promote healthy oxygen levels include mobile oxygen tanks, hyperbaric chambers, CPAP machines, just to name a few. Masks deprive us of breathing in an unimpeded fashion. No doctor has ever told a patient that they are getting too much oxygen. Psychologically, we also depend on body language. 90% of our communication is shared through body language, including facial expressions. Reading the expression of people's faces is key to our psychological well-being and survival. If you feel that wearing masks is critical to our health, please show me one peer-reviewed study that shows that face masks worn in public by everyone, infected or not, or recovered, has turned the pandemic around. You can't, because none exist. Scientist James Lyons Weiler says that science is for asking questions, not for hiding answers. So if this board is truly committed to health and science and you want to make a permanent rule, I propose a rule requiring a health-related science project permanently for all students that would encourage students and parents to conduct their own research and have informed decision-making when choosing with freedom whether to wear a mask or not. Of course, that proposal would only work if the scientific method is still allowed to be taught in our schools. Maybe part of the $1.1 billion our state received in the CARES Act for elementary and secondary schools could help fund that. I'll close by asking who here voted for Patrick Allen, and does he have any financial conflicts of interest here? Thank you for letting me express my views.
Thank you. I'm going to go back up to Shane Peck. If Shane Peck is on the line, you're up next, and then we'll have Sarah Cassidy and Kate Savannah. I'd also just like to mention, in the interest of time, we're almost at the 6-hour mark here, and we still have quite a few people signed up to testify. If you could please keep your comments limited to the proposed rule on indoor masking and try to be as brief as possible and not repeat things that have already been stated this morning. Okay, do we have Shane Peck on the line? Sarah Cassidy?
Hello, can you hear me?
Yes.
Hello, hi. All right. My name is Sarah Cassidy. I live in Eugene, Oregon. And let me start by saying that I am definitely against this mask madness. It is time to stop. It is time to move forward. Masks don't work at stopping viruses. Masks are harmful when they were worn for long periods of time. We have heard this, that they provide moist environments for bacteria, fungi, and mold to grow. I will also state that seeing pregnant women wear masks is criminal because we know that pregnant women need more oxygen to grow their babies. I also stood with nurses and doctors who were losing their jobs and livelihoods because of this vaccine rollout. And they told me it's not a lack of beds that are the problem. It's a lack of nurses that is the problem. We have lost so many good nurses and doctors because of these policies. And it's time to end. This fallacy that vaccines are the only way to health has never been true, and it never will be. If this board cared about the health of the people, they would be having conversations about banning sugar, which can be as dangerous as heroin. People have been forced to put on chainmail thinking it will stop sand, and enough is enough. We cannot be painted with the same brush. Our bodies do not work that way. My employer is not a doctor. My employer in the grocery store or any other business does not have a say in how I navigate health. I have even been stopped from doing my community theater, which I have been given my life and blood for 18 years because of these poor policies that discriminate and cause people to hate each other. I was horrified to read in this ruling that OHA wants small businesses to do their dirty work of collecting data on who or hasn't been jabbed. Not only that, but they have to pay for it. Are you thinking of the future you are creating? Take a look at history and what you are doing. Lists such as these always become a tool for hatred and possible violence. Do we make lists of everyone who got their tonsils out or who has AIDS? No, it's a violation of our many protected rights. Something this board should familiarize themselves with. We don't need a smart pass. We don't need to discriminate people based on their medical choices. And we need businesses or organizations not to be gatekeepers and segregating people. It is a fallacy that these jabs are the only way to health, period. I will end with this. According to Title III of the U.S. Civil Rights Act, Section 36.208 states, in determining whether an individual poses a direct threat to health and safety of others, a public accommodation must make an individualized assessment based on reasonable judgment that relies on current medical knowledge or the best available objective evidence. Absent of a court order or quarantine or isolation is no medical evidence that I'm a threat to the health and safety of any business. Innocent until proven guilty in the USA. Therefore, my right to equal access to the goods, services, privileges, faculties of any establishment is guaranteed by Titles 2, 3, and 7 of the Civil Rights Act of 1964. We are innocent until proven guilty. Objective evidence does not mean you must take a test and show your papers. We are secure in our papers through the Fourth Amendment of the Constitution. End this mask nonsense. Take them off your children and stop this ruling. How about we actually build a better future based on respect and common sense? Enough of this fear mongering. Do the right thing and stop this. Thank you for your time.
Thank you. Do we have Kate Savannah on the line? All right, I'm going to move on to Jerry Russell, and then we'll have Leah Ball and Matt Bennett.
Hello, can you hear me?
Yes.
Great. My name is Jerry Russell. I'm from Eugene, Oregon. I'm a retired cognitive neuroscientist, and you've asked us to focus on the mask mandate for these public comments, but according to administrative law, my understanding is the public also has the right to suggest alternatives to the proposed rule. In my opinion, the SARS-CoV-2 virus that we are all battling was created and released as a result of a research project carried out under the direction of Peter Daszak and his EcoHealth Alliance. Funding was provided by the NIAID, administered by Tony Fauci. Subsequently, Dr. Fauci apparently masterminded a cover-up. The Omicron genome is also self-evidently a separate lab creation, though its source and purpose remain a matter of speculation. It is of the utmost importance that the criminals who manifested this conspiracy must be brought to justice. They must be removed from responsibility for designing the nation's response to the pandemic, which they themselves created. And the gain-of-function labs must be shut down before the next deadly variant can be released. My guess is that the OHA and Oregon public officials had little or no input to the creation of this criminal conspiracy. It would be most helpful to the people of this state if the OHA would instead put its efforts into helping the people bring the conspirators to justice instead of wasting time with ridiculous rulemaking. As many have pointed out, it's a Nuremberg Code violation, and it's a criminal offense under US Code to coerce anyone to participate in a medical experiment. I hope there will be criminal prosecution against OHA members if this mask mandate is adopted. All it would take is one district attorney or prosecutor somewhere in the state of Oregon who agrees that a crime has been committed. Considering the people's anger expressed today, I think that's a real possibility. If this rule is adopted, according to OS 183.400, any citizen has jurisdiction to challenge the rule in court. The rule can be determined invalid if the rule A, violates constitutional provisions, B, exceeds the statutory authority of the agency, or C, was adopted without compliance with applicable rulemaking procedures. This rule violates all three criteria, and especially the requirement to comply with rulemaking procedures. The OHA cannot ignore public comment. If the rule is enacted over the objections of the overwhelming majority of public comment, that in itself is sufficient reason for a court to find the rule null and void. In the meanwhile, I hope that each and every $500 fine goes unpaid and is challenged in court by pro se litigation. And since we've learned that there's not a single decision maker from OHA present at this meeting, I was curious to find out who ought to be here. ORS 143.042 says that the director of OHA has authority over the rulemaking process. As far as I can find, there is no other board or individual taking responsibility for this rule. So he's the guy who should have been listening, and he's the guy who goes to jail if the courts agree with the people. Thank you, everyone, for being here to exercise the power of public comment. It's been a great pleasure to listen to everyone. Thank you.
Thank you. Next up, we have Leah Ball, and then Matt Bennett and Jill Brandt. Do we have Leah Ball on the line? Okay, I'm going to move on to Matt Bennett, and then we'll have Jill Brandt and Rob Goodwin. Do we have Matt Bennett on the line? Okay, next up is Jill Brandt.
Hello.
Hi.
Okay. Hi, my name is Jill Brandt. I live in Washington County. I want to start by saying it's highly problematic that there isn't transparency regarding who from the Oregon Health Authority is, or rather is not listening to these testimonies. I, along with most others who are have been on this call almost nonstop since 10 a.m. We deserve to know that we're being heard. Nevertheless, I'm going to use my First Amendment rights and testify. Once the public speaks, the response and government authorities to respond. As an Oregon citizen, I strongly oppose all current and future mask and vaccine mandates. 44 other states currently do not have any mask mandates and are not only just fine, but they're thriving, while Oregon is becoming weaker, and Oregon rule makers and lawmakers are looking foolish in the face of mounting evidence that masks are not only ineffective, but detrimental. Masks are not only useless in stopping the spread of a virus 1,000 times smaller than a strand of hair, but they are physically, psychologically, and socially damaging, as has already been stated many times. But I don't care that I'm restating it because it needs to be heard over and over again until this ends. Oxygen is carbon dioxide and harmful in a moist environment against the face, increasing the risk of infection and damaging the lungs and heart. According to my dentist, and this is something that I have not heard yet, according to my dentist, they are disrupting the structural facial development of children, which will cause them to have dental and sinus cavity problems for the rest of their lives. Are you, as members of the board of the Oregon Health Authority, ready and willing to be held liable and responsible for the damages these mandates are causing children and the people of Oregon? Masks and vaccines are a choice for each individual. No one should be forced, bribed, or coerced to receive or use one. No business should be allowed to deny service to any individual based on their medical status, or even should be allowed to request that information. And OHA needs to permanently end these pointless and harmful measures. Individuals are responsible for their own health, and we can make our own choices. These mandates and all current rules regarding masks and vaccinations, and to not implement any more mandates.
Thank you. Next up, we have Rob Goodwin, and then we'll have Nicole DeGraff and Devin Snyder.
Hello, thank you for allowing me to speak. My name is Rob Goodwin. I'm not affiliated, just a person that lives in Oregon and Yamhill County. And I stand obviously against this proposal along with everybody else on this meeting. But I thank you for giving me the opportunity to speak on this issue. Like everybody that's spoke before, all of the data points have been hit already. And we already know that the reported numbers for COVID, the COVID data, they're all a sham. And we know that this whole thing's been unethical from the start. And we know that this is all violated a number of constitutionally protected freedoms, as well as Oregon state law and tradition. I really only have a couple questions then for you. I want to know why the cost of compliance section of your documentation lists under the cost only financial and money matters. It doesn't list psychological and physical injury as part of the cost of adopting this procedure. It's very clear that we're all undergoing psychological and physical injury because of this, and yet that's not even mentioned in the cost of compliance section. But really what I want to know is why now? Why would you propose this now? Why now when we know that the local news, even the local news, is being forced to admit that this pandemic is basically over? And why now when every other state in our union is open, loosening restrictions and returning to normal life? You know, why are we doing this right now when even other countries, as was pointed out before, like England, have declared the pandemic is over and they're putting an end to all mask and vaccine mandates? Why would you propose to codify an extremely heavy-handed hardship right when the global event is ending? Just as your pandemic countermeasures are being deemed completely obsolete, you go and make the grandest infringements. And, you know, at best, this is very bad timing. But I'm sure you know this. By now in 2022, the sleeping giant is awakening. We, the people, will no longer allow rogue governments by proxy to dictate our behavior at their whims. It's not going to happen. We are now paying attention and we will take action. I really hope we stop and take a look around us at the people of Oregon. We have the chance right now to do the right thing and stop this proposal in its tracks. The event is over. Let it go. Please just stop this nonsense. Thank you.
Thank you. Up next, we have Nicole DeGraff, and then we'll have Devin Snyder and Morris Guindon.
Brittany, this is Kate Savannah. Can I get in here somewhere? I had to go out for a minute and
Hi, can you hear me? This is Nicole.
Yes, Kate, I'm gonna go ahead and have Nicole go, and then I'll go back to you, Kate.
Okay, thank you.
Hi, this is Nicole DeGraff. I think everybody's done a really great job today. I just want to say thank you for letting me have my 3 minutes, although it is not very much return on a $29 billion investment that OHA has. So I just want to know why you guys would do this. If you can pass if you have to pass this as a permanent rule, why can't you pass another rule to just extend the temporary rule? I think that's a ridiculous excuse. So, the Supreme Court recently ruled against federal vaccine mandates for employees over 100. So, this is kind of a similar issue. I'm not going to discuss safety and efficacy. I think we can sit here all day long and talk about masks are useless or masks work. But the issue with the Supreme Court was, did the president have the power to direct OSHA more broadly than originally intended? My question is, has Governor Brown done the same? I mean, I lost track of her executive orders after like 55. Has the legislature did the legislature give her or any governor broadly sweeping powers to administrative rulemaking with the intent that an illness, which has been kind of ambiguously defined as a disease, would that be the reason for restricting businesses for 2 years? I don't think that was their intent. The first year, it seemed like no one in the supermajority seemed to care if the governor was given emergency powers, which, by the way, they were originally to respond to a potential radiation crisis similar to 10 Mile Island. Now that's changed, evidenced by the bipartisan bills. There's legislators on both sides of the aisle who want to check the governor's powers because there's just been one top-down diktat after the other, no review by the legislature. So it's time to let them review. And this could give the RAC an out. Just decline to do this. Just let them have their day. The public has become bitter about unelected bureaucrats like OHA and the advisory committee making decidedly permanent rules. After 2 years, we know how to keep ourselves safe. We have treatments, knowledge, and care for our communities, and Kate has overstepped her authority given by the legislature, who I doubt ever envisioned this broad overreach. It can be permanent, even though OHA says it's not, because there's no safeguards against abuse. Where's the redress? Where can Oregonians go who may be abused by this proposed rule? How can private businesses be free to operate their businesses as they choose, as they have not been able to for 2 years? How long have we, there's no accountability. How long can we live under these draconian rules? The proposed document says there's different links. You have data that prop up this rule, but there's just as much data that exists that would harm individuals as people have testified today. There's plenty of violations to the rights of businesses and citizens. That's just innumerable. Yeah, I just want to say follow the Supreme Court's decision, their lead, and either let the elected representatives decide or simply let the temporary rule expire in February. Thank you.
Thank you. I'm going to go back up to Kate Savannah.
Yeah, hi, Brittany, thanks. So my name is Kate Savannah, and as people have pointed out today, masks and mask mandates have nothing to do with public health. So then what actually is OHA's intent when it comes to mask mandates? Who benefits from the mandate and the ways in which masking mandates are changing what it means to be human? As is obvious from much of the testimony, the people of Oregon are suspicious of OHA. We don't trust you, we don't trust your motives and your intent. Not to put too fine a point on it, but COVID is a cash cow for all sorts of big money interests and the organizations and people who cater to those interests. Billions and billions of dollars have been made, billions and billions of dollars are being doled out, many of those dollars with strings attached, or should I say masks attached, like the 1.1 billion ESSR dollars coming to the state of Oregon, as long as you agree, among other things, to mask the kids. We don't trust you, OHA. We don't trust your motives and your intent. Who is at the table when OHA sets COVID policy? Who benefits from OHA COVID policy? Pharmaceutical companies, medical technology companies, healthcare corporations, big tech. We hear a lot about the greater good and the common good, but funny thing, the commoners never get to weigh in on the greater good. As we have so clearly seen with regard to COVID, what constitutes the greater good is defined by the corporations and people who stand to make the most money off the pandemic. COVID is such a cash cow that would appear that these big money interests and the people and organizations who serve them want COVID to never end. One wonders, what are the financial ties of the OHA director and the OH policy board members to these aforementioned big money interests? The most salient piece of advice for anyone investigating government malfeasance is follow the money. What would one find if one were to follow the money trail to and from OHA? Make no mistake about it, somebody will at some point follow the money if they haven't already begun to. And what will they find? Bribery, extortion, racketeering? Time will tell, but if history is any guide, it's not likely to be pretty. OHA has an enormous credibility problem, as does anyone who has hooked their wagon to the COVID star, so to speak. You are unelected bureaucrats. Not a one of you is in the position that you are in because the citizens of the state of Oregon voted you in, or had confidence in you, or trusted you, or thought you were competent to do your job. Your contempt for the people of Oregon is palpable, and with this current proposed OHA lunacy, permanent masking, OHA amply demonstrates the words of Albert Camus. The welfare of the people is always the alibi of tyrants. And as many commenters have indicated, the people of Oregon will not sit still for tyranny. We will continue to fight. You may try to bury us, but what you don't realize is that we are seeds. Thanks.
Yes, that was power.
All right, next up.
Will we be called if we weren't on the list already today? It's going pretty late.
We're still working through the list of people who had registered ahead of time.
Well, I understand. I guess my question would be, if we weren't ahead of time registered, will we be given a chance to speak today?
Yes, if you emailed us earlier to let us know, which Mo, I do have you on the list. So next up, I'm going to go back to Leah Ball to see if she was able to join.
Hello, yes?
Yes, is this Leah?
Yes, sorry, I had to step away. I've been listening since 10, and the one time I had to step away, I got called. Well, is it okay to go now then?
Yes, please.
Okay, I am not somebody who's ever been an activist, and I think that you are waking a sleeping giant here with waking up the mothers and waking up people. And I want to say that public health must not become an alibi for infringing on the rights of millions of people around the world. I've been paying very close attention to what's happening in Australia. People have spoken about it today. They had fines of $500 to $5,000 for not wearing a mask. 14 police officers tackled a 12-year-old girl and maced her for not wearing a mask in the mall, a 12-year-old. Australia has COVID concentration camps. Their Aboriginal people are being taken off of tribal lands for not getting vaccinated. And this is because Australia is a corporation, and the corporation wants the rights to the minerals. Australia is very, very rich in natural resources. This has been the largest wealth transfer in the history of the world when they shut down small businesses. They want people to be powerless, and these kinds of mandates that they're putting in, that they're trying to have go forward, are part of that. There's more than COVID going around. There's RSV and flu, and they want to lump all of these respiratory illnesses into something that they would look at each year. And when you have a peak, they will institute, mandates and things that we have been doing all along, these kinds of things. And this is something that obviously it's wanted you want it in the record. You want it currently going on now so that you don't have to, do anything when that needs to be done. There's another virus plan for 2025. There's one for 2028. This is not ending until we stand up as people. I'm so happy that that people today are speaking out. Dr. Fauci knows that masks don't work and that they kill. In 2016, he wrote a paper about the 1918 pandemic. He wrote that more people died of bacterial pneumonia than from the pandemic itself. That's from the mask wearing. I have periodontal disease. It's become worse since the masks. I have dry eye that I got from wearing masks. And I want everybody involved in passing this mandate to understand that I will serve each person with a notice of liability for personal damages to me or any one of my family members from mask wearing. And that will mean that they are personally responsible, and I will seek legal action against each person individually. 87% of people who contracted COVID illness either wore a mask all the time or most of the time. I know people who wear a mask all the time. They have COVID. They've had COVID this week and prior. And I've already had 4 friends move out of the state. If this mandate continues, my family will leave the state. California has had a mass exodus. For the first time they've had in the history of California, they've had more people moving out than moving in. Do you want this for Oregon? Do you really want to lose more tax dollars? That's all I have to say.
Thank you. I'm going to go back to Matt Bennett. Are you on the line? All right, next up is Devin Snyder, and then we'll have Morris Guindon and Michelle Province. We have Devin Snyder on the line. Okay, next up is Morris Guindon.
Can you hear me?
Yes.
Yeah, this is Morris Guindon. And I'm with the faith community up here in Warrenton, Oregon. I've been in the state of Oregon since 2013, and what I've noticed, I don't want to reiterate what everybody else has been saying. Everybody's been doing a fantastic job. But from my perspective of the faith community, I've seen more division come into our community than ever before because of these mandates. And the CDC guidelines, the guidelines that have been given to us through the state have been confusing, to say the least, to most of the people that attend our churches. It's just become an astronomically huge thing for our communities to deal with. And I've listened to some of the other counselors. It is a huge mental health issue. It is a huge spiritual issue as well. In one regard, I have to actually thank you guys for implementing all of these mandates, because it's forced people to look inward, and they have to start asking themselves all these questions. What am I doing with my life? What am I doing here in this state? We've had several people move out of the state of Oregon because of what's going on, and I've heard that reiterated over and over again. But the insanity that we're supposed to accept this permanent mask mandate when we can obviously all see that this pandemic is winding down. Even secular media is now saying that we are winding down. Why are we even proposing a permanent mask mandate? Whether or not it could be rescinded later is immaterial. It's just insane. I'm also a student in organizational leadership, and what I'm seeing is a forced groupthink within our society here in Oregon. Just to end quickly here, because I don't want to take too much time, but the majority of the faith community, they resent and reject the allocation of critical race theory rhetoric that I saw in the proposal. I'm like, what was that even doing in there? If this is supposed to be a health crisis, why are we talking about systemic racism? Absolutely no place, and in that proposal. It shouldn't have had any place in the proposal. But what that shows me is that there is an emotional hijacking of our society. And with that, I'll close.
All right, thank you. Do we have Devin Snyder on the line? Okay, I'm going to move on to Michelle Province, and then up next will be Joanna. I'm really sorry about this last name, Norovsky Pecoraro, and then Lori Wyman. Do we have Michelle Province on the line? All right, we'll come back. Joanna Norovsky Pecoraro.
I'm turning on my camera. Oh, my camera's turned off no matter what. Okay, I wanted you to be able to see me, everybody, especially OHA staff, to see that I am a non-threatening person. I'm not going to repeat all the stuff everybody else said, except to tell you about me and my other concerns about all this. I'm 65 years old, and I have a background in education, communication, and health. I'm speaking for at least 10 people in my immediate family that could not come on today because of work. And I want to thank you, Brittany, for being polite, and I'm incredibly impressed by everybody else's comments and testimony. I was raised by people who were responsible for hundreds of people's lives. I'm a first-generation American, and I've lived in Oregon since I was 20 years old, since 1977 almost. And my concerns, what I want to bring up is that, sorry, now I've been waiting for so many hours, that there's an elephant in the room here that hasn't been talked about, which is that there's two things. The board does not get to vote on this. The OHA board has no voting on this, and a lot of people don't know that or listening. And the other concern I have is with this $500 fine. Oh, I live in Ashland, Oregon. My name is Joanna Norovsky Pecoraro. That where is the enforcement for this $500 fine going to come from? The OHA staff and directors will be at home or in their offices, but what does this mean for stores, police, sheriffs, and what do our elected representatives think about this? This is going to put staff and restaurants and all kinds of people in tremendous distress. And did anybody think about what I'm listening to today, to everybody's eloquent and every kind of Oregonian? And I'm so proud that every type of Oregonian and all ages and occupations pretty much has spoken today, that there is going to be turmoil. And I'm not saying this from a threatening place, but I've been a leader. I'm retired now, but I've been in a lot of leadership positions. And where is the forethought about the turmoil that will ensue? And I'm also concerned today about the professionals that I thank them, and I'm concerned for them for their bravery, courage to speak up. And maybe the OHA thought that we would just go along with this. But the elephant in the room, there's two things. There's money and there's civil disobedience. Because why are we continuing this, as everybody has mentioned, and I have traveled all over the US in the recent past. 46 states do not have this mandate. Obviously, countries in Europe are dropping them. And why are we going forward? The only thing I can think of, with all the facts that have been given and have been emailed, that this would be going forward. The only thing I can think about is emergency funding. And then there's a civil disobedience part, because what will occur if everybody in Oregon continues to say no? This is going to be ginormous. I don't even have the words for it. And we have been considering moving. We've been watching everybody move. And I'm really upset that the legislative body doesn't get to vote on any of this. And are you prepared? Is OHA prepared, and the governor and the elected representatives, for what's going to occur? Because listening to everybody today, this amount of people on here today represent 3/4 of Oregon. And so what is going to happen? And I have a lot of concern about that. Thank you very much for listening.
Thank you, Joanna. This is Kara Biddlecombe with OHA. I'm going to take a turn here for facilitating our list. I would like to do another check for Devin Snyder or Michelle Province. Do we have Devin Snyder? Do we have Michelle Province?
And this is Dr. Melanie Carlo, and I had technical difficulties, but I think my name was called as well.
Okay, well, we'll check where you are. Let me go to Lori Wyman, and after Lori, we'll have Veronica Carlson. Lori Wyman, are you on?
Yes, thank you. Thank you for the time
Please
to
go
give
ahead.
today. I believe the Oregon State and OHA are pushing mandates and masking to receive funding or any other money grab from the federal government. And let's be clear, that is ultimately our money. It's time to stop. And we say by changing the mask ruling from temporary to indefinite, this will be a grave mistake. You will lose more students from schools and hardworking taxpayers from the state of Oregon that will relocate to other states, and you will see great resistance from all who remain. You will also contribute more damage to those who have already lost jobs due to illegal mandates and infringing on constitutional rights. Plus, this will create a massive influx of health issues for all ages. Are each of you at OHA and the state willing to take this responsibility on? I don't think so. And to echo the $500 fine, this is not the National Guard's responsibility or any other military organization to collect. I have no idea how this would potentially even be a possibility. These groups are being used as pawns, and that is not right. OHA claims to respect health practices, which so far is not happening. It's not happening at OHA or the state level. It's an American freedom and a right to determine our own health choices and actions. I am strongly against and opposed to any more mandates or masking rulings. I do not feel it is an authoritative place for the state or OHA to determine what and how individuals should be moving forward and living their daily life. Every citizen is responsible to make the best choice that applies to their own life and their family. Let's be clear. Masks are for doctors performing surgery and preventing germs from getting into open wounds. They're not for everyday wear. Masks are not good for children, and they cause fear and bacteria and damage to their little minds and bodies. They also cause massive damage, which has been talked about in this meeting today. From the Journal of Infectious Disease and Epidemiology, Adverse Effects of Prolonged Use of Masking During COVID-19. A study was completed to review the effects which are resulting in is headaches, clearly not getting enough oxygen, skin breakdown, acne, rash, and impaired cognition. And another study review from Healthline, wearing a mask constantly can cause a sore throat. When you mask, changes the moisture content level of the air you're breathing in. You can develop symptoms of a cold or virus via a mask that has been exposed to bacteria or a virus, including a sore throat. Regular taking masks off and on can increase the likelihood of transmitting germs to your mask. This applies to all types of masks. Other symptoms for masking: dry skin, dry mouth, acne, bad breath from bacteria, irritated, inflamed nose, nasal passages, headaches. I'm almost done here. Hypoxemia, respiratory failure. I mean, the list is so long. It's absolutely shocking that we are still talking about this. It's incredibly dangerous to think about individuals driving around in their vehicles with masks on that are not 100% coherent. This has got to stop. We cannot stop closing down and shutting down and suppressing people every time someone gets sick. It's
Thank you for your comment. We are over time, so we're going to continue on. I do want to go back to Melanie. Please go ahead.
Thank you. I'm Dr. Melanie Carlo. I am a healthcare practitioner with a master's and doctorate in physical rehabilitation. I served in the United States Navy as assistant department head of the physical therapy department at Bethesda Naval Hospital, and I also founded their health promotion program. Back in the 80s, I've been in this business for a long time, and while I express appreciation for the forum of a public conversation, I am also aware that we are operating on very limited information in our policymakers. I want to share, and many of you may know, but when a baby is born, it has 10 with 17 zeros behind it, viruses in its fecal matter. Its first poop is filled with virus. And if you were to eliminate that virus, you would kill that child. A cup of seawater has 10 to the 28 viruses in it. Viruses are a natural part of a healthy terrain. And what we found is that our terrain, the elements that cause health and well-being in the human being, have been so degraded because of our environment. This is why this particular virus and all pandemics find their niche. What we also know is virulence reduces over time, and it's critically important that we have bioinfluencing. We are designed to be in connection with each other. Viruses are information packets. They are not living entities. They pass information amongst species, interspecies, and in the same species. Without those conversations and that contact, we lose connection with our environment. This whole viral thing, yes, there has been a coronavirus. Yes, it has been deadly for people who needed to be isolated and were not. Instead, there was reverse isolation for a very low morbidity rate, and those who were sick were the ones with comorbidities that were not addressed. Imagine if we applied the same amount of alarm for diabetes, which is currently killing people at an enormous rate. In another 10 years, 1 in 2 people will have diabetes. The other thing I want to point out, I don't know that people understand, but right now there is a Article 7 under the U.S. signatory to the International Covenant on Civil and Political Rights. No one shall be subjected to torture, cruel or inhuman, degrading treatment or punishment. In particular, no one shall be subjected without his free consent to medical or scientific experimentation. There is now, and it's very difficult to get information on, but right now there is an active court case at the International Criminal and Tribunal Court at The Hague, to which the US and other European nations have signed on as an adjudicant for lawful matters. As of December 6th, there has been a proceeding underway by Hannah Rose Schotbolt, who is an attorney, and her lead is Dr. Mike Yaden, who was the former vice president and chief scientist of allergy and respiratory research at Pfizer. He was directly involved in the mRNA vaccine rollout. He has come to be a whistleblower. It is no accident that several weeks later, the UK, of which is the one named in this lawsuit, dropped their COVID restrictions, their masking, and their mandates. So get smart, Oregon. We are on a list. This is not the time to be rolling these things out due to money. We are being watched.
Thank you very much for your comments. We are going to move on. Veronica Carlson, followed by Marlene Pickens and Shelley Bernier. Or Bernier. Do we have Veronica Carlson? Okay, next is Marlene Pickens. Do we have Marlene Pickens? Shelley Bernier or Shelley Bernier? Apologies if I'm not pronouncing your name correctly. Okay, next we have Colin Farnsworth, followed by Sharon Wursevit and Mary Pate. Colin Farnsworth, are you on? Do we have Sharon Wursevit? Sorry if I'm not pronouncing your name correctly. All right, Mary Pate.
Can you hear me? Can you hear me?
Yes,
please.
that Mary?
Yes, Mary.
Just go ahead.
Thank you for letting me speak here. And first, I would like to pray for everybody on this board and the participants. And the Lord bless you and keep you. The Lord make his face shine upon you and be gracious to you. The Lord lift up his countenance on you and give you peace, peace that surpasses all understanding. Holy Spirit is with us today, because I prayed this in the morning as well. I have a religious objection to masks. The veiling of the face is a Muslim practice of submission to Allah. This is not a Christian practice, and it is an affront to our Lord to imply that his divinely designed system of a built-in air filtration system, the cilia in the nostrils, is somehow deficient, is a violation of a Christian worldview and an abomination to our Lord. Requiring a Christian to veil the face with any sort of face covering, mask, or shield would be akin to requiring a Sikh person to remove his turban, which would violate Sikh beliefs, as well as a Muslim woman to take off her burqa. God breathed the breath of life into man, and man became a living soul. It is an affront to our Creator to be forced to veil the face and restrict our God-given breath. God created human being with only two airways, the nose and the mouth. We do not breathe through our ears. God breathed into the nostrils of man. And Genesis 2:7 says, God breathed into the nostrils of the breath of life, and man became a living soul. And Revelation 11:11 says, the breath of life from God entered them. We are clearly told by the Lord to stand before him with face unveiled. And from 2 Corinthians 3:18 it says, and we all who with unveiled faces contemplate the Lord's glory are being transformed into his image with ever increasingly glory, which comes from the Lord, who is the Spirit. Covering the nose and mouth and concealing one's identity is shown to us in the Bible as activities done by prostitutes and those who turn their faces from God in shame. And Genesis 38:15 says, when Judah saw her, he thought she was a prostitute because she had covered her face. And one more verse from the Bible is, if you have been fooled by being proud or plotting evil, cover your mouth in shame. Proverbs 30:32. No one should cover their face because it's an expression of God-created creature. We were created by God in his image. And never in the Bible it says cover your face because it's a commandment. And Oregon Health Authority, unfortunately, is not over God's commandment or constitution that reflects God's laws. Thank you.
Thank you, Mary. Okay, I'm going to go back and see if we've had Shelley Bernier, Colin Farnsworth, or Sharon Shoreck.
I want to say something really quick for Sharon Shoreck. For whatever reason, it will not allow her to unmute. She is on. Perhaps you can unmute her.
Okay, let's work on that while we take the next comment. We have in the next group, Mary Ulch, Diane McDermott, or Amy Ulch, I'm sorry. Do we have Amy Ulch on? Okay, Diane McDermott, and I'm still trying to work on finding Sharon, so just bear with me for a moment.
I'm Diane McDermott.
Please go ahead, Diane.
Okay, moved to Oregon in 2006, have lived in other states, but I found Oregonians to be the most health conscious people I have ever met. I've been a health and nutrition researcher for over 30 years. What people might not know is that microbiologists, virologists, and MDs are not certified exposure control experts. So regarding masks, other than a certified exposure expert, is like a dentist performing brain surgery. It's outside their field. Stephen Petty, that's P like Paul, E-T-T-Y, is an exposure expert qualified to measure the air in an enclosed environment. Petty served as a national exposure expert in more than 400 cases, including Monsanto, Roundup, and DuPont. I encourage the OHA members to listen to Petty's podcasts, especially number 3. Quick summary. The size of a virus is less than 1 micron. A micron is 4,000 times smaller than the diameter of a human hair. The fabric of any mask, even a N9, forget it, whatever that number is smaller than the diameter of a human hair, and the fabric of any mask has holes in it that are approximately 0.0635 centimeters. 1 centimeter is 10,000 microns. You cannot seal a mask. Masks are of no use. Studies show that droplets are not the problem. They fall almost immediately to the floor. It is the small aerosol particles which are problematic. Asbestos particles are 5 microns, 5 times larger than a virus particle. Yet page 6 of OSHA manuals states that masks are not protective for asbestos. Yet somehow masks are protective for a virus which is 5 times smaller in size. There's no logic here. What does work, according to Petty, ventilation and destruction using needlepoint ionization technology added to the HVAC intake fans to kill viruses, mold, and bacteria. That's where the money should be spent. Over 1,000 studies, and people have referred to them today, show that masks restrict breathing and oxygen flow, which lowers the immune system. The mask captures carbon dioxide plus moisture and heat, thus becoming a breeding ground for mold and bacteria. What people might not know is that the heat and the moisture in the mask will cause the minuscule fibers in the mask itself to break down along with the chemicals in the mask. So you'll be breathing all of those things. The Government American Rescue Plan and Elementary Secondary School Emergency Relief gives $122 billion to schools. And one of the requirements to get that money is to enforce masks. Are you required to enforce masks on the people of Oregon in order to receive federal money? Is there no liability to the people for enforcing something that is contrary to public health? Masks do not work, they cause harm. I completely oppose the enforcement of masks.
We're gonna have to stop. Your time is up. Thank you very much. I do want to go back. Sharon, I see you on the participant list, and I'm not seeing that you're that there's any issue with your mic. Sharon, are you able to speak?
Hi, this is Shelley. I got called earlier too.
I'm sorry, what is your name?
Shelley Bernier.
Okay, please go ahead.
Okay. I'm a native Oregonian and a United States Army veteran who served 24 years. I served in Iraq and since have been diagnosed with numerous medical issues and deal with a weakened immune due to time there and vaccine injury from anthrax injections. I developed frequent migraines, numbness in my face, joint pain, and I lost use of my leg for over 3 months. I have intense weakness, numbness, spontaneous cramping, twitching, and I can barely walk. I also developed trouble in breathing. I have moments where I get chest pains and my chest tightens up. I get dizzy and lightheaded and have cognitive issues as I struggle for air. It is like breathing through a straw. Imagine trying to breathe through a straw. It is hard and makes your lungs struggle to get air. I have heard one of the excuses for wearing a mask is to protect my health or the health of others. Is this a cruel joke I am to seriously believe? My health and others in the same situation as me has not mattered since 2019 within the state of Oregon. As a veteran who served and is labeled as disabled, I cannot even get medical care at the VA medical facility that is supposed to help those of us who serve this country. I cannot wear a mask. When I put on a mask or shield over my mouth and nose, I panic because I struggle getting air into my lungs. I tried for about a month and my breathing difficulties increased as did lightheadedness, joint pain, and PTSD. Any ethical doctor with integrity who truly does care about the health and well-being of others will truthfully acknowledge continuous mask wearing does more harm than it does good, especially to those who already have lung or heart issues or PTSD. Masking is causing numerous long-term health issues for many. It seems as if there are individuals within Oregon who desire to cause further harm to the health and well-being of others, not help. My daughter has also not played sports since 2019, as I will not place her in harm's way. So are we at the point in American history where rights and health choices are limited to just certain classes of individuals? The right to choose to wear a mask or not should be individual. Individuals should not be coerced or forced against their will to do further harm or damage to their own body or mental status, even to the point of risking their life, unless it's not about one's health. ADA rights have been ignored by numerous government-run agencies and some businesses here in Oregon as well, rights that I fought for, and yet they are removed from me and many others for over 2 years now. COVID-19 is highly recoverable with the proper effective treatment. I am a testimony to that. With my lung issues and weaker immune system, I used safe, effective protocol and I recovered, as have many others who followed well-known and documented protocols by compassionate doctors who effectively helped their patients' recovery. I pray for Oregon and the people who live here. I pray for our government. We have allowed spiritual darkness to descend as well as God's judgment. May he forgive us for the damage and evil harm we are doing to many, including the children. So I am asking for a no on permanent mask wearing.
Thank you. Let's go ahead. Sharon, I'm going to try one more time for you again. I'm not seeing that you're having an issue with your ability to unmute on my end. So if you can, if you're on the phone, maybe try *6 or otherwise press the unmute. I'll give you a moment here to do that.
Can you hear me now?
Yes, please go ahead.
Okay, I had to move to my phone from my PC. Thank you so much for trying back. Hello, my name is Sharon Shoreck. My husband and I are small business owners. We have 2 sons, one of whom is in public school. We live in Ashland, Oregon. I want to start by sharing with you that I hardly recognize the town that we've lived in now for 23 years. Ashlanders have done an excellent job of following the mask recommendations. People who used to hug, smile, and greet each other in grocery stores no longer even make eye contact. People fear one another, and social media banter confirms that. There's no rigorous science to support that masks protect us from the virus, but they do cause severe collateral damage. The psychology that comes along with masking pits us against one another. Masking and other government mandates divide and diminish us. When we mask, we unconsciously send the message, I am a danger to you, and you are a danger to me, leading to avoidance and self-isolation. Now, there's a huge cost to isolation, which so many people have spoken about today. Human beings are relational and need to communicate non-verbally, exchange facial expressions, see smiles, and also touch one another. These natural interactions between members of the human race are critical to building healthy communities and healthy bodies. For our government to force us to cover our faces is to take away what it is to be human. Masking must be an individual's choice. The studies show that facial expressions specifically communicate empathy and develop trust. All community members are impacted by these imposed communication deficiencies, but especially our children in their most critical period of social development. Depression and anxiety are much higher in masked communities. Behavioral health issues in our schools are at an all-time high. The suicide rate, I learned, among teens in Jackson County is now up 53%. Our children and youth must be unmasked now to learn critical life skills. Now, add in the harm done to the hearing impaired, cognitive and sensory impaired, those with autism and other disabilities. This is a grave accessibility issue too. Indefinite masking is an attack on our communal life, our mental health, our inalienable right to breathe oxygen. It is a tragedy and a crime that our state leadership is willing to sever our communities, the masked against the unmasked, take away our fundamental rights to interact as human beings require, interfere with our right to make our own medical choices, and then penalize and criminalize us should we say no. To add this rule is inhumane, an attack on the citizens of this state, and an equal attack on our democracy, as you can hear us loud and clear today. We demand that you halt this proposed rule change. Thank you so much for allowing me the time to speak today.
Thank you, Sharon. I know that we can go back, I believe, to Marlene Pickens. If you are on, Marlene, please go ahead. Doing another call for Marlene Pickens. After Marlene, we have Steven Jankowski, Carissa Bristow, and Mark McSorley. Marlene Pickens. Okay, let's go to Steven Jankowski. Carissa Bristow. Mark McSorley.
Oh, hello. Can you hear me?
Hi, who is this?
Carissa Bristow.
Okay, please go ahead, Carissa.
Hello, OHA. My name's Carissa Bristow, and I live in Lyons, Oregon. I wholeheartedly oppose this proposal. I want to address one of the goals from the proposal. OHA wants to impose a mask mandate to reduce the impact of COVID-19 on service industry workers and vulnerable communities. How can you prove an employee contracted COVID-19 at work? How can you prove these vulnerable communities caught COVID at retail spaces? Both these groups catch COVID at home. Neither the CDC nor OHA have provided data demonstrating that any specific industry outside of healthcare is more at risk from COVID-19 than others in terms of hospitalization and deaths. I want to share how the mask has limited my personal health. I absolutely love hot yoga, but for the last 2 years, I've not been able to participate. Yoga's foundation is breath work, and having your breathing restricted with a mask makes it impossible and unsafe to perform. Tons of exercise studios across the state have closed because people don't want to suffocate while exercising. You are preventing actual health with these rules. It's completely backwards. It goes against your own mission statement, which is to help people and communities achieve optimum physical, mental, and social well-being through partnerships, prevention, and access to affordable healthcare. What happened to the golden rule? Treat others as you would like to be treated. These rules are causing people to be discriminated against daily. It should be everyone's choice to wear a mask or not. A large part of our state wants to join Idaho because of these restrictions. No one should be mandated to breathe in extra carbon dioxide. I'm going to cut right to the chase. The public knows masks do not work. OHA knows masks do not work. So the real question is, why are we doing this? In your heart, you know this is wrong. You feel bad trying to impose this. That is how you know you're off track. Pat Allen won't even show up because he knows how wrong this is. This goes against human nature. The public knows you are being given billions from the COVID cash cow to impose this. The fact is you have no authority to impose this. It is outside your regulatory role. You're an unelected body and you are completely bypassing our elected officials. What you're trying to do is illegal. I have a suggestion. Because this impacts everyone in the state, why not put it up for a vote? Let the people decide if they want $500 fines and a mask mandate that never ends. We both know it would never pass. I don't understand why you aren't against this. Think of your own children's future. Do what is right and withdraw this proposal today. Stand with the people. Thank you for your time. Oh, and to all the patriots listening, let your representatives know Pat Allen doesn't show up to rulemaking hearings. Thanks.
Thank you. Let's see, we'll go back. Steven Jankowski, if you're on, please go ahead. How about Mark McSorley?
Hi, my name is Mark McSorley. I'm a disabled veteran. These last 2 years have actually been pretty rough for me because I can't wear a mask because of PTSD issues, because of my service for our country. If I need medications or if I need groceries, I have to send my wife to the store. And the sad part is she works 40 hours a week, plus her commute times and everything else, to come home at midnight to go on a shopping trip for me. I mean, and we want to continue this. I mean, I have no life. And it's pretty sad and pathetic that stores and businesses and our state treat us the way that they do. Thank you.
Thank you, Mark.
Excuse me, Kara?
Yes,
My
go
name
ahead.
My name is Danny, and I'd like to make a short request. Based on the public input that we're having today on the masks, there's 2 hearings scheduled for Monday that treat masks and vaccine mandates. I would like to make a public request to postpone those public hearings until we get the results from this hearing. It really doesn't make any sense for us to take another day of work on Monday to talk about this.
Danny, I do want to just, again, because we're here to comment on the rulemaking at hand. You're bringing up other rulemakings, and so we're going to stick to what we're here today. Thank you for your comments, and I'm going to continue down on the list of folks who had previously signed up and have been waiting potentially since 10 in the morning. Let's go to Susan Graves. After Susan, we have Melissa Lapp and Ruby McClorley. Susan Graves, are you on? Melissa Lapp? Ruby McClorley, I apologize. Okay, after Ruby, we have Ron Vrooman and Justin Tome, followed by Andra Salmon.
Hi, this
Ron?
is Melissa Lapp. Sorry, I needed to get to a place where I could speak.
Go ahead,
Okay.
Melissa. Thank you.
Thank you. My name is Melissa Lapp, and I'm a resident of Sherwood. And I'm not going to beat a dead horse about the ineffectiveness of masks or the dangers or inconveniences that they pose. That has been well established today by my very articulate fellow Oregonians. But I would suggest that the question still needs to be asked: where is OHA's evidence that masks do more good than harm? If the state of Oregon desires to force a permanent indoor mask mandate, the onus should be on you to provide overwhelming evidence that, 1, the mandate will achieve specific outcomes, and we need to know what those outcomes are, and 2, the achievement of those objectives vastly outweigh the continued burden on Oregonians to adhere to a rule that is physically and socially detrimental. If insufficient evidence is provided, then this rule should be allowed to expire. This is the only reasonable and appropriate outcome, and clearly, by the testimonies given today, the citizens of Oregon have spoken. Thank you.
Thank you very much. Ruby McClorley, are you on? After Ruby, we have Ron Vrooman. Ron is followed by Justin Tome and Andra Salmon, and then Mo. One last call for Ruby and Ron. Ron Vrooman, Justin Tome, Andra Salmon. Mo, are you on? I don't have a last name for Mo.
Oh, yeah, can you hear me?
Yes, please go ahead.
Okay. Yeah, we've covered a lot of stuff. Today. So anybody who's, sounds like everyone's paying attention. Everyone should be watching or listening to Ron Paul and the Tom Woods podcast. Both of those are really good. They've been very great at exposing the insane misdeeds of the government of Oregon. Yeah, the ERs and OSH, many of these medical facilities are completely packed and understaffed, and it's because of these mandates and the interference from the government. So now the policies that are supposed to be helping Oregonians are literally killing them. If it's a very bad time to have a heart attack, it's a very bad time to want to go to the ER and get some prompt medical treatment, and this is all a result of the policies of Oregon. So you guys really ought to stop these things, and not just the mask mandate, but all these mandates. None of these things are legal. You don't have any reason or authority to tell people what to do. Nobody should comply with any of these these mandates or whatever you call them, and they should all start disobeying now. In Portland, you have to step over the bodies of the living dead just to go to the store. There's crime everywhere. Their murder rate has gone up some number of fold. You can't even enforce basic crime laws. Every time I go to Fred Meyer's, there's someone running out the door thieving, or someone in the bathroom shooting up. So how are you going to all of a sudden make the rest of Oregonians all criminals for not wearing a mask? It's completely absurd. Now, there's billions of dollars at stake, apparently, for you guys based on some sort of federal gift that's been given. Is that the reason that you guys are no longer listening to the voters of Oregon? And definitely, speaking of voters, you guys have to know that you're alienating voters at a rate you've absolutely never reached before. So, I mean, if voting does work, well, then it's going to definitely turn around soon because you've heard it. Hundreds of people have talked today. Not a single person agrees with these mandates. Oh, also the insane cowardice of the people that are making these rules. They're not here. They've silenced everyone's face. They tell everyone to sit on mute. You have to wait in line for hours and hours just to talk. This is not democracy. We're not allowed into our own Capitol building, and you have to obey all these stupid laws or else they bounce you out and trespass you. So this is not how democracy works. It's been massive problems from the leaders of Oregon. And yeah, this needs to end. And as a matter of fact, for everybody on the call, it probably should end. It should be over. Don't wear your mask. Don't comply. Don't listen to any of these things. If they give you a fine, don't pay it. And by the way, who's going to give out the fines? All the cops that have been fired this year? Nobody.
Not that I did it for the feedback. Oh yeah, I mean, I was on there. That was why I was doing it, or I wouldn't have been on all day.
Mo, just doing one last check if you needed to say anything else, or if you were concluded. There was too much background noise, so we had to mute everyone.
Oh, okay. Yeah. How much of that roughly covers it. Did you guys hear that? Oh, there is one more thing. There should certainly be a class action. There's absolutely anyone with a religious exemption that doesn't need to be a part of all these antics. They're being forced to get out of their stores, get out of their jobs, get out of their lives. Where's the class action lawsuit holding Oregon responsible for discriminating against people based on their religious beliefs? This is a complete step backwards in the civil rights movement being done by shadow government, people that are not elected. These are unelected people doing these things to Oregon citizens. It's a complete shame. Every one of you should be ashamed. Thank you.
Thank you. Okay, I'm doing one last check for Andra Salmon. Followed by Andra, we have Doug Hill, Tina Bacon.
Hi, this is Andra Salmon.
Please go ahead.
Okay, yeah, I just wanted to first start out with a prayer. I wanted to pray to God and thank Him for everything that He has done for us, and for watching out for His children and taking care of our souls. And we ask that He cut the chains of slavery that actually this has created for us, and so that our elected leaders don't have the control that they did have over us. We ask that you protect your children and from these tyrannical mask mandates and vaccinations, quote unquote, mandates. In Jesus Christ's name, amen. The other thing is, so Kate Brown feels that she is able to do all of this stuff. But does she realize that when she gets to the top, or when she sets at the world, a new world order, that she's not going to be anything other than a useless eater like she considers us to be right now? And so so this is basically going to come back on her, and it's going to bite her in the ass. Thank you.
Thank you. So we have Doug Hill. Tina Bacon. Oh, Doug, go ahead.
All right. Well, first and foremost, I would hope that the testimony today is taken seriously, and that the people that will make the decision on this rule are present and are listening to us. If not, then isn't this anything more than just an exercise in futility? The overwhelming health and mental effects of wearing masks has been well covered today, so I'll skip my comments on that. The infamous flip-flop Dr. Fauci said the following in an interview with 60 Minutes. When you're in the middle of an outbreak, wearing a mask might make people feel a little better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. I believe a little perspective is in order here. There are 6 million accidents on American highways this year. That's a lot of injuries, a lot of suffering, billions of dollars in medical bills, 35,000 fatalities. We also know that those numbers could be dramatically reduced this year if the government mandated a speed limit of only 20 miles an hour, required all motorists to wear a helmet, and forbade left turns. Would you support such a mandate, knowing full well that the lives would be saved? If not, why not? What about a nutrition mandate? 40% of Americans are obese. 71% are seriously overweight. Think of the millions of lives we could save if the government outlawed sugar and fast food. Would you support a mandate that eliminated your favorite foods if the government told you that doing so would save lives? If not, why not? Is it absurd? Of course it is. But is it any more absurd than millions of people covering their faces with ill-fitting, totally ineffective cloth masks for nearly 2 years? Is it more absurd than forcing millions of children to do likewise? Is it more absurd than watching countless elected officials brazenly defy their own mandates? No one wants to die of COVID, but how much absurdity can we endure? And how much government intrusion is justifiable in order to increase the odds of surviving a virus with a survival rate of 99.97%? Omicron is evading masks, vaccines, and boosters. Current data suggests that Omicron infection may be nature's vaccine. I sure hope so. Our officials refuse to articulate the metrics whereby these mandates will end. Seriously, what are they waiting for? A better survival rate? Fewer cases? Fewer hospital admissions? A higher vaccination rate? A thumbs up from the teachers union? The promise of a risk-free world? How much more mandating are we willing to endure to avoid a virus we're all going to get? How much more mandating are we willing to endure to improve upon a 99.97% survival rate?
Doug, that was your timer, and so we are going to have to move on. Thank you for your comments. Next, I have Tina Bacon, followed by Scott Stewart, Melody Short Boyce, and Michaela Begg.
Unfathomable.
Tina, are you on?
Yes. Can you hear me?
Yes, go ahead.
Okay. I'm a mother and a grandmother born here in Oregon. I'd like to thank everybody for the time, and I want to thank everybody for taking a stand today. I appreciate everything. In regards to the mask, I wanted to share something that I learned recently. It has not really been talked about. I learned recently about ESSER 3 COVID money for the schools. And that's E as in Edward, S as in Sam, S as in Sam, E as in Edward, R as in Robert. It is part of the American Rescue Plan. And there is over $28 million that's been given to the Oregon schools. And it talks about having new HVAC ventilation systems, and it's for capital projects and more. It does have requirements to receive the money, though. One of the things is they have to mask the children. It also says they have to do health assessments. A local school board recently shared their excitement for the money that they were receiving for a new roof and an HVAC, while the parents were at the same board meeting speaking out about their concern of masks on their children and health surveys that were sent home. The health surveys were asking about things that only adults should be asked about. Examples are like, what type of parents do you have in the home? Are they the same sex? Are they not? If the children in the home are adopted, or are they a product of artificial insemination, and more? I have to ask the question, are these surveys and things a product of the ESSER COVID money? Parents need to be checking into this with their board. Where is this money coming from? And what are the requirements to keep this money? People really need to monitor the COVID money coming into the schools, along with the Oregon Health Authority. These are these other mandates. It looks like candy to receive this money, but there's the stipulations, and the school boards are not being transparent about that with the children's, that if they receive the money, what they have to do with it. I'm appalled that the whole committee and board today with the Oregon Health Authority are not listening. And Brittany keeps stating, or did state, I'm not even hearing her now, about don't repeat things. It is freedom of speech, and we are allowed to testify as we see. And if we repeat, it helps, as I heard earlier, solidify how many Oregonians feel so strongly about this. I do ask, when will the decision be made, if this can be told to us today? And also, I'd like to note at one of the local schools, with the mask piece showing division, there was a poem that was inserted into a program.
That was your timer, so you have gone over. We are going to go ahead and continue to move on. Thank you so much. Scott Stewart, if you are on, could you please go ahead?
Hey, I'm on. Can you hear me?
Yes, please go ahead.
Wonderful. I just want to thank everybody. This has been absolutely phenomenal. You guys have been great. And I do thank OHA, and for you poor employees, it probably most of you feel the same way we do, but you're kind of stuck. You got to do what Pat and Rachel and Dean want to do. And they are unelected officials. You know, they're dictated to by Governor Brown. And we all got to admit, Governor Brown, she owns the court system. She owns the state agencies, the legislature, the schools, because she is the superintendent of schools. She owns the media, and she owns the voting machines. So it's kind of like we're kind of like left up to we the people. But we got to remember, we the people formed the state governments, and then the state governments formed the federal governments. And if you look at Article 1, Section 1, you can form a social compact. You can change this existing government, and you can do it through peaceful non-compliance. It's not civil disobedience. We're not the ones that are breaking the laws. The state government is breaking the laws. So is OHA. Get your pen out. I'm going to give you a few websites I want you to go to. Number 1, People's Rights Oregon and the number 5.com. People's Rights Oregon 5, the number 5.com. You can download my Breathe Free booklet. This is golden. This is invaluable. This is about a 60-page document, and it includes OSHA's Breathe Right Guide to Respiratory Health. And on page 7, it says if you're wearing a mask, you're not getting the 21.5% oxygen concentration level. You're getting way less than that. Yeah, this is OSHA, the guys that like to go fine people for not wearing masks inside their business. All right, and the other website is No Mask Student Rallies. NoMaskStudentRallies.com. Watch what happens in Redmond, Oregon. Remember my name, Scott Stewart, Stuart. We're from the royal side of the Scottish family, Stuart. ScottStewart.vote. I'm running for Deschutes County Commissioner. I'm the candidate that says what you're thinking. And what you're thinking is, we got to turn this thing around. So folks, listen, take heart. Be strong, stand firm, take off your masks. Just quit conforming. This just prolongs the nightmare, okay? So they're going to probably force this thing down our throat, okay? So I'll leave it with that. Good luck. Call me. I'll tell you about masquerade parties. You're going to love that one.
Thank you, Scott.
You're welcome.
Okay, we're gonna go ahead to Melody Short Voice, followed by Michaela Begg. Melody, if you're on, please go ahead. Michaela Begg. Okay.
This is Melody. Can you hear me?
Yes, please go ahead.
Can you hear me? Oh, good.
Yes,
Thank
go
you.
ahead, Melody.
My name is Melody Short Voice. I'm an acupuncturist here in Portland, and one of my main specialties is pediatrics. And I want to, since everybody's already covered so much of the science and so much of the other stuff, I wanted to focus on a few personal cases. My family happens to be hypersensitive to poor air. We are a disaster during the wildfires and things like that. We are like canaries. We start vomiting. We start having all kinds of symptoms with things like that. With these masks, it's even worse. And having children vomit in masks is not cool. So for my family, any of these masking mandates make it so that we are completely excluded from any place that is requiring them. For my own work, I can handle a face shield alone, but only for about an hour at a time. I have had to completely restructure and restrict my availability and my schedule around this. And it's not okay for you to be mandating medical devices broadly. Additionally, I want to talk about some of the harm that I've seen amongst my patients. I had one patient who was a pregnant nurse, and the only time that she would wear masks is when she was working. But that was enough of a disruption to her oxygen and an increase in poor air that her baby stopped growing at 26 weeks. Luckily, we were able to get her off on home rest, so she no longer had to wear masks. We did a bunch of treatments and herbs to increase oxygen and to increase blood flow to the baby. And we managed to keep her from going into early term labor, because not only was the baby not growing, but her uterine lining was thinning, which if you look up what are the symptoms of oxygen deprivation in pregnancy, that's what it is. And her baby was born small, but healthy, but only because we intervened as soon as baby stopped growing. I have count after count after count of the harm that these masks are doing. I don't care if somebody wants to wear them on their own, but people should not be forced. And the idea of making something like this permanent is just, it's so insane. It's so insane and cruel. So from somebody whose heart rate hits 145 to 155 within 5 to 15 minutes of donning a mask, who can only handle the restriction of airflow of a face shield for about an hour without getting heart palpitations and migraines, as somebody who knows how useless those masks are. And yes, I am an acupuncturist, not a surgeon, but you know what? I was trained as to why we wear protective material. It is for blood splatter. Surgeons wear masks because of potential fluids squirting out of their patients. You don't want that in your mouth. It has nothing to do with bacteria and viruses. It is a shield. It's the same reason we wear lab coats. And I just wanted to say thank you for listening. And I can hear the exhaustion in your voice. And I appreciate that you have kept this going and continued to listen. So thank you.
Thank you, Melody. Okay, we're going to go to check again to see if Michaela Begg is on. Then we're going to go to Mary E, followed by Lance Hoover. Mary, are you still on? Mary, if you'd like to testify, please unmute yourself.
Sorry. Oh my God, I walk away for 1 second. Okay, do you hear me?
Yes, please go ahead.
Sorry. Well, I don't think the government or OHA cares in any way. I think the decision was already made and it's going to be enacted in March. This meeting's all theater and show. I don't wear masks and I don't plan on wearing a schmuck mask. I don't take orders from lying bureaucrats with a dystopian monetary agenda. This is your political suicide. I've been a lifelong Democrat, but not anymore. You hate us, and we're going to get our revenge and get you out of office. You people hijacked our Democratic Party to promote fascism. Big corporation, big medical, and big government, all working together. The people are left out. You want to strangle me with a damp, germy, snotty, petri dish cloth festering with bacteria. A homeless person's underwear is more clean than these masks. New research just came out from LA County. The cases of COVID have skyrocketed after forced mandates. 3,774% explosion of COVID after the mask mandate. Same thing with Israel. And with that evidence, you want to enforce a mandate? How dare you? This is the truth. Masks destroy your health and lungs. Disposable face masks have toxic asbestos-like substances. You breathe these down, they're from China. Even the box says it doesn't stop transmission of disease. You suck in these infinitesimally small microscopic fibers coated with chemicals deep into your lungs. You're going to get mesothelioma, a COPD, pulmonary disease, and lung cancer. It doesn't happen overnight. It's festering in your lungs right now. The maskers need to demand financial reparations from the state and OHA for the future care of their medical issues. This is a class action reparations lawsuit. This is a financial scam by OHA and their buddy hospitals to make people sick and profit from COVID and their lung diseases that they're creating. OHA individuals need to be held accountable and sued for reparations. Yesterday, Fauci said constant masking is out of the question. Constant masking is out of the question. That's from COVID. What's next? We either move out of the state of Australia and take our tax money with us. We don't need a passport to go to the next state where there's freedom and sanity. No one is moving to this fascist state. People are leaving. I already know 4 that left. You can have your dark, threatening, dystopian disease reality. Own it. Enjoy your disease obsession. Or we can be buying billboards across the state showing the Nuremberg Code and the research graphs that clearly show mask mandates cause COVID to explode. It's a fact. Oregon is known internationally around the world for its utterly despicable display of insanity and violence. And now this utter stupidity of permanent masks. Oregon is a worldwide embarrassment. The whole greedy state.
Mary, that was your timer, so we're going to
That's
move
okay.
on. Thank you very
Thank
much. Lance
You
Hoover,
rock. You rock.
Lance Hoover, please go ahead.
All right, thank you.
I'm sorry, Lance, please unmute yourself again.
All right, thank you. Can you hear me? Hello?
Yes, we can. Please go ahead.
Great. All right, thank you for the 3 minutes. I'll be brief. I'm not going to speak to the science. Everyone here has already spoken to the science. A brief background for me, I am a mechanical engineer, and so I understand the science. I do have a question for the presenters on this call. It's my 3 minutes, and I want to spend it the way that I think would be best for everyone on this phone call. I would like to point out, as the mechanical engineer in the room who understands exactly what's going on in this phone call, who is the shadow presenter with no name? Answer that question. That is my 3 minutes. You have 2 minutes to answer.
Lance, my name is Kara Biddlecombe. I'm with the Oregon Health Authority. We don't know all the names of everyone who was on the call. So, and we're also
Nope,
not.
That's not my question.
responding
My
to any
question is
questions.
presenters.
So please,
Who are the
please,
presenters on the call who have admin access to this call right now? Name them
Lance,
out.
we
Tell
are
me
not.
who's here.
We are also
And
not
please
answering
open up your
questions
mic
during
and
the
just say your
hearing.
name.
The purpose of the hearing is to comment on the administrative rules.
And I
If you do
understand
not
that. And
choose
I
to
want to make
comment on
sure
the
I know who I'm
administrative
talking
rules,
to.
we will move on.
I just want to
Thank
know
you.
who I'm talking to before I make my last 30 seconds of a statement. Who am I talking to?
we're going to go ahead and move on since your comments are pertaining to the rules.
Okay, then you've just violated
Brittany
RS
Ruiz, please go ahead.
192.630 and you will be held accountable. Thank you.
Brittany Ruiz, please go ahead.
How come nobody responded to Lance? Whatever.
Brittany Ruiz, please go ahead. You're next. Okay, not hearing Brittany, we're going to go to Kayleen. Kayleen, please go next.
Hi there. My name is Kayleen. I am a teacher's assistant at a daycare. I work with infants to children up to 15 years old. Now, the young lady who's 15, she obviously can stay home by herself, but her family has asked that she come to our daycare because they found her attempting to commit suicide. This is in our tiny little town, and our directors agreed to take her in for free because this is such a scary, like my hands are shaking right now just talking about it. I had COVID now twice, and there was never a second where when I was sick, wishing that I wore my mask more, that I got all the boosters. Absolutely not. I trust my immune system to survive. And with a 99% survival rate of this virus, I will continue to trust my immune system. I want to thank everybody who chimed in today, submitting testimonies. You guys are amazing. And how dare OHA not even be here for the hearing? That's all I have to say.
Thank you. Let's go ahead to Donna, and then we'll go to Michael, Timothy, and Free Lane County. Donna, please go ahead.
Hi, this is Donna Lowry. Thank you for your time. I will keep it very brief. So I have the opportunity to work with some fabulous kids here in Eastern Oregon. And I have watched and witnessed over the last 2 years that they have been masked up, the changes in their personality, their speech patterns, their overall mental health has deteriorated because of the mask mandates in school and in private entities, businesses across the region. I actually have the ability to travel to Idaho I think the air is clearer over there within the businesses. So the COVID restrictions are less. I can take my dollars that really do need to stay in Eastern Oregon to support our businesses, but I can freely access other businesses, other places. But it is a detriment to what these mandates are doing to our children. And I would hope that OHA would spend their money in mental health, behavioral health, speech health, physical health to bring our kids back from the last 2 years of devastation. I thank Free Oregon and their support. I wish I was barbecuing with you today, but I had to work with my kids and help them be successful young adults, model behavior, and my modeling behavior by working and following what I need to do to keep them healthy and safe. Thank you and have a fabulous evening, and keep supporting and fighting against these crazy, overbearing, reaching mandates. Have a good evening.
Hi, this is Brittany Ruiz. The Microsoft app kicked me out, so I couldn't respond when you were calling my name. Can I speak now?
Go ahead.
Okay, my name is Brittany Ruiz. I'm a Yamaha County resident, also been an Oregonian for 7 years, and I know actually a number of you at OHA. And specifically, I want to take issue with public meeting laws, specifically regarding this meeting. I only heard about it through a friend. It's not posted on any social media that OHA currently uses to notify about other public health measures. And I think that's a mistake, whether malicious or unintentional, I don't know. I would also like to make a point to let people know who have asked questions that there have been members of OHA on this call, and I'm pretty sure Director Allen is now on this phone call. I also see that Dr. Dean Seidlinger has been on this call. OHA Council, Jean Windham has been on this call, and obviously Kara and obviously Brittany Hall. So for those who've asked those questions, if you check, you can actually see who are not members, who are attendees, sorry, who are actually possibly with Oregon Health Authority. So those, hopefully that answers that question. My purpose of today's call also brings up glitches with public meeting law where people who are deaf or hard of hearing could not participate due to no subtitles, and we do not have videos to verify who we are speaking with the Oregon Health Authority, and there's no interpreter, which should have been provided by the Oregon Health Authority. So I believe, based on public meeting laws, that this meeting should be redone. Not saying that all the people that have given the opportunity to comment need to comment again, but we need to make sure that all public meeting laws are being followed so that everybody can have access to this meeting. My final point, so I don't use up my 3 minutes, is I think whoever attended this meeting and the people who have given comments have done an amazing job. And I can't really add to that other than just point out that I really hope and encourage OHA to conduct another meeting to ensure people who are disabled have access to be heard, and that an interpreter and video is done on the next phone call. And that's just my main 2 cents. And I'm also opposed to the mask mandate. And I believe with every other state going back to normal, we remain a minority. And I think we should move ahead and grow and not go backwards. Thank you so much.
I second that.
Thank you, Brittany.
Okay, we're going to take Michael and then Timothy, and then that will be it for today. Michael, please go ahead.
This is Jim Schaefer again. I asked several hours ago if I was on the list. I was mailed in, got an early response on getting involved in this conference call, and you've yet to give me clarity if I'm on the list or not.
Jim, this is Kara. I do not have you on the list.
Kara, just to clarify, earlier Brittany said everybody who's here will have a chance to get their voice heard.
We required that everyone register in advance of the meeting. We do accept written testimony as well, so I will pass this over to Brittany at this point to get us closed out if we have called on everyone who did register in advance.
There was a problem. Email people.
Sorry, that's not true. I registered in advance, and
I believe that Brittany stated earlier that he would be able to speak, and he was on the list.
I heard the same.
I believe that Brittany recognized the error.
Brittany said I was going to be able to speak as well, Free Lane County, and now I've been bumped. What's going on?
That's correct. That's correct.
This is Kara Biddlecombe, and with the Oregon Health Authority, we did require that folks let us know if they were going to testify in advance. We are accepting public comments. I'll ask my colleague to please make sure that we have shared with you the email address for forwarding your additional public comments. So, Brittany, would you like to close us out?
I registered and got an email, and now I'm not being allowed to speak.
We are about to close out, so
my First Amendment rights are being.
Thank you for everyone who has joined today, and I assure you that the agency will consider fully all written and oral testimony. That brings this meeting to a close. Again, we are accepting public comments until 5 p.m. on Monday, January 24th at publichealth.rules@dhsoha.state.or.us. That concludes this hearing at 5:18 p.m.
Please postpone Monday's hearings until this one gets a result.
Everyone listening, get the audio and the transcript and share it with everyone.
FreeOregon.us. Ben Udel's the man.
I demand the 24th meeting be pushed out.
I agree.
I demand that the people that were voice. The people
I
that
am
were promised a chance
so
to speak can speak
disgusted.
today.
We want to hear
I
all the
agree.
voices. Jim Schaefer needs to talk.
Bunch of cowards. Bunch of cowards. Hide behind your screen.
Let's stop pretending this is about health and safety. We know what you all are up to. We see you, we know what your agenda is about, and we are not putting up with it. You better be shaking in your boots right now, as I know you are, because we are coming to take over. Do you understand us? We are not putting up with this. I have never worn a mask. I will never wear a mask. I will never get shot up with your drugs. I will not put up with panic agenda.
That's right.
OHA's our coward, and so is Kate Brown. Show up.
They couldn't take everyone's voice, that even the ones they registered to take.
It looks like the presenters are down to 2 people. I say let the gentleman speak.
You announced my name that I would be 4th in line to speak. You took 2 more people and then you took us all off.
Hello. Hey
We
guys.
know that you are not going to take
You have a chance.
anybody's
Guys,
voice.
they're gone.
Your days are numbered. Your
Hello?
days are numbered.
Can you hear me? They're gone.
The recording is
They're
still going
gone.
though, so we're on the record.
Everyone listening, get
They're
the
gone.
audio, get the transcript, and share it.
Yes, I hear you. And also, I suggest you get the transcript and that everybody fax the transcript to every single legislator, member of OHA, and school board. If you can afford to do it, get the transcript and start faxing it everywhere.
Nice.
This is
My
Catherine.
name is.
Good idea.
My name is. Let
Okay.
me say something. My name is Jody King, and I spoke. Oh gosh, it was like almost 11 o'clock, and I'm deaf, and I had asked for closed captioned. They did not provide it within time for me to hear it before I spoke. I pointed that out. So all I got was like this simple apology, and they're going to mail to me the entire meeting. I don't know if it's going to be in video format or whatever.
These
So
I was wondering the
I'm
same
gonna
thing about captioning.
Is Jim
I'm gonna
Schaefer
spread
still
it.
there? Maybe Jim could talk because there's 100 of us here. Why don't we try?
Yeah,
to